So guys, let's continue this GT70 discussion. This is question number 101. Now, in this question, the 38 female presented with confusion, trachea, and acute kidney injury. She reported recent episodes of bloody diarrhea a week ago. Lab finding shows anemia with cystocytes with severe thrombocytopenia and elevated LDH and indirect bilirubin. Which are the following most strongly suggests diagnosis of TTP versus HUS? That means we have to differentiate between TTP versus HUS. How can we differentiate between two of them? Let me insert image. Okay, let us repeat this question again. 101 question. What does it say that which of the following findings would strongly suggest a diagnosis of a TTP or HUS hemolytic uremic syndrome in this patient? Neurological symptoms in addition to the renal involvement is the first option. Elevated LDH, recent history of the bloody diarrhea, and presence of fragmented cells. Now, first, these are at very two close differentials, HUS and the TTP. TTP, there is a classic pentode, and in HUS, there is a classic of triad. What does this in HUS? There is a renal insufficiency, there is a thrombocytopenia, and there is a microangiopathic hemolytic anemia. The same microangiopathic hemolytic anemia is also seen in TTP. Renal absence is also seen in, and what's called a thrombocytopenia is also seen. These three are also seen in TTP as well as HUS. And both these show similar kind of findings. However, in TTP, there are additional two findings. One of them is an neurological findings. That means the main differentiating point between TTP versus HUS, it will always be a neurological findings versus other or favor. So, neurological symptoms in addition to the role involvement, it will be definitely in TTP. Elevated LDH, it will also, it will be seen in, I think, both TTP as well as in this cases. Bloody diarrhea is suggestive of HUS because Shigella toxin at all, they will do the hemolytic uremic syndrome. Presence of fragmented cells, it suggestive of this microangiopathic hemolytic anemia. Fragmented cells, whenever you find a fragmented cell, it is suggestive of microangiopathic hemolytic anemia. It is seen in both TTP as well as HUS. So in this question, you should remember TTP, pentode, and hemolytic uremic syndrome triad. Yeah. Question number 102. 60-year-old female undergoes a prolonged gynecological surgery. 3 weeks later, she presents fever, fatigue, and a new onset murmur. Blood culture reveals it's in gram-positive cocci. 5% of NaCl. We should know better classification of gram-positive bacteria that grows till 6.5% of NaCl. Let us go to the classification. Gram-positive bacteria, they are divided into bacilli, cocci, and branchyclimates. Question is asking about the cocci. Cocci are divided on the basis of catalyzed positive and catalyzed negative. Among the catalyzed positive, those who are catalyzed positive are known as streptococci, negative are known as staphylococci. The streptococci are further divided based on the hemolysis, alpha, beta, and gamma hemolysis. Beta hemolysis are divided on the basis of basic sensitivity. These are and no hemolytic patients are beta. Gamma hemolysis, alpha, beta, and gamma hemolysis patients are divided based on growth of on 6.5% of NaCl. Those which grow on 6.5% NaCl are known as the enterococci bacteria. These are known as enterococci bacteria beta. These are known as enterococci bacteria. So we find the answer that gram-positive cocci that grows in presence of 6.5% is an enterococci. is an antidote, and it belongs to which category? It belongs to catalase positive. It belongs to streptococcal category. That means it is in catalase positive. Here it is in catalase positive. Here this is in catalase positive. This is not. This is not enough. These two options will have ruled out catalase positive, catalase positive. Got it? And this, beta, this patient, it is an bile esculin positive as well. Remember, enterococci is an bile esculin positive as well. Enterococci is bile esculin positive as well. So, how to solve this question? Whenever there occurs a gram positive, gram negative bacteria is always good. Always try to go back and remember the table, gram positive table as well as gram negative table, and you will try to add the pointers like here enterococci you will try to add these are bilasculin positive. So come make this table as a one and try to write the differentiating pointers in this single table so that whole classification of gram positive bacteria comes in a single page. It will help in loss need to revise all the bacteria. A patient presented with findings given below. Which are the following traits are you likely to see in this patient? देखो बेटा क्या है बेटा. Patient has low partial pressure of the oxygen. Okay. And normal PCO2. Patient has normal PCO2 and has an high atrial versus partial pressure of oxygen gradient. This patient has an high gradient versus alveolar and arterial gradient. High oxygen gradient between alveolar versus arterial. What does this mean? Beta? Low partial pressure means hypoxemia. But having normal carbon dioxide and then gradient, beta, it suggests of this patient has a type 1 respiratory failure. Why I am telling that? In type 1 respiratory failure, there is an problem in impaired oxygen diffusion. Impaired oxygen diffusion means that this patient has a deficiency of this oxygen. This patient has deficiency of this oxygen because because alveolar and intrapulmonary problems are there. Question number 103 will be repeated. Author again. Given below, a patient presents with. Question number 3 will be repeated again. Question number 103. A patient present with findings as below. Which among the following histories are you likely seen in this patient? As you see in this patient, the findings of low partial pressure of oxygen and normal carbon dioxide. Low PO2 and normal carbon dioxide, what will we see? Let us not make the diagnosis first. Let us see in which of the following condition will have a low oxygen and normal carbon dioxide. Let us see. Sedative drug overdose with shallow breathing. If we patient has a sedative drug overdose, sedation will cause decrease of the respiration. When there is a respiratory centers are decreased, that means patient will not breathe normally. The respiratory movement will be decreased. Decreasing respiratory movement is called PCO2 will remain. Carbon dioxide will remain inside lung beta. When carbon dioxide remains inside lung, that means PCO2 will increase. Here in option PCO2 is normal. That means this will not be an option. Option number B, sudden onset chest pain, shortness of breath. Patient had a sudden onset chest pain and a shortness of breath. Sudden onset chest pain and a shortness of breath. Sudden onset and shortness of breath. What does this patient? This patient will have a try will have a hypoventilation. Hyperventilation. Sudden onset. This patient will have an will have a Shortness of breath. This shortness of breath is called the hyperventilation of these patients. What about this other? The progressive muscle weakness, ptosis and fatigue. This is known as a myasthenia gravis. This patient, when there occurs a weakness, progressive muscle weakness, when there occurs a diaphragm muscle weakness, that means respiration does not occur. When respiration does not occur, what this occurs? This carbon dioxide gets again trapped and it causes hyper. This PCO2 will be again increased. Recent were followed by ascending same. When there is the paralysis, respiration does not occur, so PCO2 will increase, PCO2 will increase in all the other three conditions except this one condition. This looks totally different from others. There occurs a shortness of breath. In this one there occurs a hypoventilation. In this there is a hypoventilation. In D option D there occurs a hypoventilation. There is only one option left where there is a hyperventilation. In hyperventilation, beta, carbon dioxide will be either low or it may be normal. Low. And why hyperventilation? Because hyperventilation, because this patient has a low oxygen demand. This patient has a low oxygen and the demand is high. That is what he is hyperventilating. So this, as per the history, as per the given option, the history must be this patient must be having a acute chest pain and a shortness of breath and positive. That means positive demand, they must be suffering from this pulmonary embolism. This is a case of beta type 1 respiratory failure, in which there are low partial pressure of oxygen, normal or increased partial pressure of carbon dioxide, and there is a high gradient versus alveolar minus arterial oxygen. This is a triad which is seen in type 1 respiratory failure. In type 2 respiratory failure, there is low partial pressure of oxygen and there is low partial pressure, there is high partial pressure of carbon dioxide, and there is a normal gap between arterial versus alveolar gradient. Try to remember better again, type 1 respiratory versus type 2 respiratory failure. Type 1 respiratory failure में there is low partial pressure of oxygen. In type 2 there is low partial pressure of oxygen failure. In type 1 there is normal or decreased partial pressure of carbon dioxide. However, in this there is an increase in partial pressure of carbon dioxide, and there is a high gradient of partial pressure of alveolar minus arterial oxygen, and there is a normal gradient in type 2 respiratory failure. Okay, this is characteristic thing value. There is a this carbon dioxide, this is hypercapnia is seen in this type 2 respiratory failure. In this patient, this was type 1 respiratory failure, and based on the history, only option that goes with is type 2. Now, question number 4, beta. Question number 4. What does this question number 4 tell us, beta? The initial RNA transcript is modified. Now the patient now has an a sequence on 3' and which of the following statement is incorrect? What does this mean, beta? Suppose this is an DNA, beta, 5' 3' direction, and there has a double stranded DNA. This has 5' 3' one strand, and another strand is 3' and 5'. And the strand which is 3' 5' acts as a template strand, and the one which has an 5' 3' coding acts as a coding strand. Now this template strand is transcripted. It is transcripted during the transcription process into the mRNA. From DNA we get mRNA. mRNA will have this sequence of 5' 3' sequence, because this template strand will be used for the synthesis of this mRNA. Now there occurs once mRNA is synthesized better from the DNA, there occurs post-transcriptional modification. These post-transcriptional modifications, they will stabilize this mRNA and they will make it more functional. What are the post-transcriptional modifications of this mRNA? There occurs at 3' end and as well as 5' end. At 3' end, there occurs the addition of this. There occurs addition addition of this there occurs the A sequences. There occurs addition of these this adenine sequences, poly A sequences at 3' end. This is known as this is known as polyadenylation. Addition of this poly A sequences at 3' end is known as beta polyadenylation. And similarly, there occurs addition of 7 methyl guanosine to the 5' end. This is known as the beta capping. This is known as capping. These are the two post-transcriptional modification. One is known as polyadenylation, another is known as the capping. Capping occurs at 5' end and polyadenylation occurs at the 3' end. What are the functions of this? Now we will see the incorrect process about it. What question says it occurs in the nucleus? Yes, better. It occurs in the nucleus. It occurs. Does it require a DNA template? No. Post-transcriptional modification does not require DNA template. DNA template, but this was the DNA template, this was the DNA template, this was required for transcription. Here, this was the DNA template. It transcripts into the mRNA. Now, this mRNA post-transcription, the modification occurs on this mRNA, not this DNA template. So it does not require beta DNA. Poly A tail protects mRNA from, yes, it protects the mRNA from this exonuclease attack, so that this mRNA does not break. Polymorph is involved in this beta. This occurs, the addition occurs with the help of enzyme known as poly A polymerase. ठीक है बेटा. तो answer will be here. It requires a DNA template. DNA template is required for the transcription process, not the post-transcriptional process. 105 question. A 25-year-old woman was subjected to hysterosalpingography and the following images. What is the most likely diagnosis? Most likely diagnosis. देखो बेटा, this is a uterus. This is again a second corner. This is one corner and this is a two corner. And the both corners are seen. They are separate. They are totally separate. When these are the two uterus, they are when we say there is a separate uterine cavities. This is in one uterine cavity and this is in another uterine cavity, and both the uterine cavities are separated. They are they are no attachment. They are not related to each other. This is better known as uterus didelphus. This is known as uterus didelphus. So beta, this is an uterus didelphus. What is an beta? I have added the images better. How you will see, this is a normal uterus. Here this is a single uterine cavity. This is a unicornate uterus. Only one corner of the uterus is present. Here this is a beta arcade uterus, and this is there occurs a fundal indentation, and this is a septate uterus. Here in between these two corners there is a septate. This is a beta bicornate uterus. There are the two corners of the uterus and they are connected to each other at the base beta. They are joined at the base, and this is a uterodidelphus. They are totally separated. They are totally separated beta. How you will differentiate bicornate? This will be a bicornate uterus beta, and didelphus it will be like this. Okay, beta. So I have added the classifications as well. Here the following Muller-Induct duct anatomy was proposed by Bertram and Gibbons classification. Class 1 is Mullerian hypoplasia. Class 2 is, 2 is a unicornate uterus. 3 is an didelphus. 4 is bicornate uterus. So it was class 3 as per this. Question number 6 beta. A human was admitted with a bacterial pneumonia with pleural effusion. Pleural analysis was specific gravity of 1.031 and contain a large polymorph neutrophils. Which among the following best characterizes this pleural effusion? Beta, as we know that there is a lightest criteria for whether this is an exudate as versus transudate. Now, in this patient, it is not exudate versus transudate. The patient sheet, it is based on the specific gravity. Now, for exudate beta, based on the specific gravity. If specific gravity is greater than 1.02, it is an exudate beta. If the specific gravity is less than 1.02, then it is an transudate. Based on specific gravity, if we can divide it on exudate as well as transudate. If the specific gravity is greater than 1.02, it is an exudate. Here in this option beta, specific gravity is given 1.031, so it will be an exudate. Which among the following? There are different types of exudate, so option A is wrong, it is an transudate. Now among this, fibrinous exudate, serous exudate, and purulent exudate. In exudate beta, in exudates, if it contains neutrophils or leukocytes, then it will be a purulent exudate. If it contains a fluids only, no leukocytes or any cells, then it will be a serous exudate. If it contains fibrinogen or fibrinous in the pleural fluid, then it will be a fibrinous exudate. Here in this, the pleural fluid contains polymorphonuclear neutrophils, so option will be a purulent exudate. First, you have to find whether it's a transudate or an exudate based on the specific gravity. 1.02 is a cutoff. Question number 7. 40-year-old diabetic man presented with painful erythematous lesion, purulent discharge on the time. There is a gram secreting of the pus. Which of the following antibiotics cannot be given? Here, this is a gram-positive organism. It's a gram-positive organism given. Now, which among the following antibiotics is not given against the gram-positive organism? Here, beta, if we see clearly, beta, gram-positive organism, vancomycin, it is an against gram-positive organisms. But it is used for the gram-positive organisms. Linezolid, it is against the gram-positive organisms. Clindamycin, it is beta given for anaerobic as well as aerobic infections. Beta, it is for the gram-positive organism. Now, except acetonome beta, this is beta is mainly used for gram negative bacteria. It is mainly used for gram negative bacteria beta. These three are used for beta gram positive organisms. So the option was which amount of following is not used, antibiotic is not used for gram positive. So it will be a acetonome which is used in gram negative organisms beta. Here, the 3-year-old child is brought with a high fever, dysphagia, drooling of the saliva, muffled cry, and a neck disturbance. On examination, there is a torticollis, a bulge in the posterior pharyngeal wall. There is a bulge in the posterior pharyngeal wall. Lateral X-ray shows a widening of the prevertebral soft tissues. Widening of the prevertebral soft tissue. Which lymph nodes are involved? But first, you have to know the spaces and clear cut, and the history and the spaces is important for this patient. Why beta? The patient has a respiratory symptoms. There's a dysphagia, drooling of the saliva, and a neck stiffness, high fever, and there is a post-pharyngeal. It is given as a post-pharyngeal wall. Pharyngeal wall, bulge in the post-pharyngeal wall, and a lateral X-ray shows widening of the prevertebral soft tissue. This widening of prevertebral soft tissue occurs in two conditions: prevertebral abscess and second is retropharyngeal abscess. These are the two conditions in which there occurs a widening of the prevertebral space. Now, in prevertebral condition, prevertebral abscesses, there occurs neck pain, again given here, but it is mostly seen in tuberculosis. It is seen into burn. There occurs this destruction of this vertebrae at all. But in retropharyngeal abscesses, there occurs a fever, drooling of saliva, dysphagia, and muffled cry. Characteristic seen dysphagia, drooling of saliva, muffled cry. This is seen in these retropharyngeal abscess. This is seen beta retropharyngeal abscess. In the retropharynx, there are lymph nodes beta. These lymph nodes are known as nodes of Rouvier. These are known as the nodes of Rouvier. Here, this is given. This is a beta pharynx, and this is a postpharyngeal wall. It is covered by buccopharyngeal fascia, and this is in vertebra. Here, this is in prevertebral fascia. The space between the buccopharyngeal fascia and the prevertebral fascia is known as retropharyngeal space, and the lymph nodes known as the lymph nodes beta. So beta, and in between there is a septa, so retropharyngeal. So this abscess will be mostly a unilateral one. Because of this septa in between them, it will not allow the infection is from this side to move to this side, so it will be always a unilateral case of retropharyngeal abscess. Prevertebral abscess, they can move here and there, and they have a deep communication. So that is an important point to remember here. But now, an unclaimed dead body was brought for forensic examination. Post-mortem examination reveals a complete fusion of the joint, shown with an arrow mark in the below. What would be the approximate age of this person? Beta. This is in manubrium, and this is sternum manubrous sternal joint. Beta. When will this get fused? Beta. Fusion usually occurs. Beta. Fusion usually occurs here. The fusion usually occurs at greater than 50 years. Fusion of this body segment is fusion of these segments. This is the body beta, this is the manubrium, and manubrium, it fuses with this body at the age of 50s, and this body segment is beta. Between the body segment is here, the individual bones of this body, they fuse by the age of 20, up to age of 25 years beta. And the fusion of the body with this xiphoid process usually occurs at the age of 40 to 45 years. So at last, manubrium fuses with the sternum at the age of 50 years. So at the age of 50 years will be the answer, beta. Question, important question, beta. 45-year-old woman with uncontrolled eosinophilic asthma and high dose of ICS has a recurrent exacerbation despite good adherence. Drugs, she is taking drugs properly, but she has acute recurrent exacerbations with elevator of the FNO eosinophils. According to GINA 26 guidelines, what will be the next appropriate step? What will be the before labeling her treatment refractory beta? Before labeling her treatment refractory, go to the guidelines. What does the guidelines say is that beta? If a patient, has persistent symptoms despite adherence, this patient's characteristic of this patient, adherence habit is patient drug area, but he has a persistent or has an beta exacerbation. Now what you have to do? Add lama. You have to give a lama to this patient, but this patient has already, and you will add lama, and what you will do, you will refer for the assessment of the phenotype to this patient. You will go before labeling to a respiratory refractory. You have to add, first you have to add lama, then you have to refer for assessment of this patient, phenotype assessment of this patient. What we will do? Add maintenance oral prednisone? No need to add because he is already on high dose. Switch to saba? No, because SABA is a beta blocker. Beta blocker can cause down degradation of the beta receptors. Then they will cause a bronchospasm. Assess the phenotype, direct biological eligibility, and modify the comorbidity. Just we need to assess this phenotype of this patient as per the guidelines. We need to assess if a patient is on high dose and present still and have a good adherence, and still the symptoms are not improving, or patient presents with acute exacerbation, we need to go for this beta. Question number 1111. 20 years old man with a history of drug usage that comes, oh patient, the drug that comes in a colorful graphic blotting paper, characteristic of the LSD beta. Whenever you see a colorful graphic blotting paper present to the OPD with visual perception changes beta. Visual perception changes, it is not important. What is important is a colorful graphic blotting paper. It is an LSD. Says that if episode starts for minutes for 4 months, which does the most likely consume, what other drugs can cause similar symptoms? But similarly, it is caused by LSD and dimethyl tryptamine. These are the two drugs which usually occur in colorful graphic blotting papers. So whenever you see a colorful graphic blotting paper, always think about LSD, and you will see a flashback phenomenon, bad trip option में होगा बेटा, bad trip, flashback phenomenon. LSD will cause a hallucinations. So the ultrasound of a pregnant woman given below shows the following. Which are the ultrasound? Oh beta, this is the supina biped. The image shown, it is in supina biped. Supina biped. What are the other USG findings seen in the supina biped? Others are seen in lemon sign, banana sign. These are the two signs which are other seen in supina biped. Here this is in lemon sign. Bagel sign is seen in ectopic pregnancy. T sign and Spalding sign is in preterm death beta. T sign is in seen in this what's in this placenta. T sign is seen in this beta placenta. Okay, now I hope you got monochorionic diamniotic placenta beta. A surgeon performing cortical mastectomy and number. So I will enter image question number 13. Beta. Question number 13. A surgeon performing a cortical mastectomy is unable to enter the mastoid antrum despite adequate drilling. The surgeon is not able to enter into the mastoid antrum. A dense bony palate is uncovered, which later is identified persistent petrosquamous suture. So, during the mastoid surgery, the surgeon is not able to enter because there was a petrosquamous suture. Failure to recognize this suture may result in what will happen because of this. There occurs an injury to internal carotid artery, maybe incomplete mastoid exenteration, maybe facial nerve paralysis, maybe CSF leak, maybe. Let us see mostly what does this mean, because performing cortical mastectomy, not performing a patient is performing cortical mastectomy. So if a patient has an infection, so surgeon wants to remove the abscess, remove the infection from the mastoid hair cells. Now because of this suture, he is not able to remove all the infections from this. So most common, go with the most common. Most commonly, it will be incomplete mastoid exenteration. So he may be not he may be not able to remove all the necrosis, all the materials, all the infections from the mastoid. This will be the best answer. How? But this is the corner septum, which is known as persistent petrosquamous suture, which is also known as beta petrosquamous suture, and this is the beta mastoid. Person, the patient, this surgeon tries to drill it, but he is unable to pass because of this suture. Because of this suture, he is unable to remove. He is unable to remove from this mastoid air cells. So what will happen? This will be incompletely cleaned. The mastoid will be incompletely cleaned. So best option will be incomplete mastoid exenturations. Best option will be beta incomplete mastoid option. This exenteration beta. These are other, there may be complication, but these are very complicated, rare at higher stages. But the basic, the starting, the common thing will be this mastoid will not be cleared properly. Old girl was brought, question number 140. Old girl was the symptoms suggest of bleeding. Oh, she has a bleeding disorder. The test reveals a normal platelet count is normal, prolonged bleed time, and defect in the platelet aggregation. So there is a platelet aggregation defect. So there are two types of defects. One is adhesion defect, platelet adhesion. Again is aggregation defect. The platelet is aggregation defect, normal switch stage rule is a defect in. He is saying clearly. So aggregation defect usually occurs the defect at GP2B, and third A receptor. And the adhesion defect occurs at GP second B. These occur the aggregation defect is beta here, and the adhesion defect occurs here GP1A here. GP1A receptor here occurs the adhesion defect, and here occurs GP second B and third A, in which the two palliators usually aggregate. This defect in it occurs the aggregation defect. Which are the following drugs on the same receptor? Which are the drugs which act on second B and a third receptor? Beta. This is the table. The drugs which occur on second B, third, epiximab, and the drugs which occurs on them is this beta. ठीक है बेटा epiximab this clopidogrel et al, they are irreversible py2 inhibitors. ठीक है बेटा ठीक है Rivaroxaban is in beta factor XA inhibitor. ठीक है no molecular weight apparent, it acts factor XA inhibitor and factor 2A inhibitor. ठीक है is an py2A is an inhibitor p2y2 है ना. This is irreversible p2y inhibitor. Now, which are the following maternal drug exposure congenital animal pairs is correctly matched? Valproic acid, beta valproic acid cause bacterial defect. T means teratogenic. Teratogenic means neural defect. Beta yes, valproic acid causes a neural defect. Lithium usually causes Ibsen anomaly. So limb reduction is no. Warfarin causes bleeding disorder. Cranio Cicatal craniodysplasia. It causes craniodysplasia. It causes fetal warfare. Isotretinoin causes craniofacial and cardiac defects, not stapler devices. Here, this is in Laos. It is also impossible transmission. Laos causes transmission of beta. It causes Laos causes transmission of this letter. L means Laos. A means it causes epidemic typhus. T means it causes trench fever. R means it causes relapse in typhus. It causes a relapse in fever. So how you will remember? You will remember it by letter. Letter means Laos. Laos causes epidemic typhus. It causes trench fever. It causes relapse in fever. It does not cause endemic. Endemic is caused by rat fillet. So, old man with acromegaly, patient has acromegaly beta, remains clinically and biochemically active despite undergoing transcranial surgery के बाद भी beta, this patient has inactive. Receiving maximum dose of somatostatin receptor ligand, he is initiated on drug sex. He is initiated on drug sex. Shown in the what is the identify and primary monitor parameter of this drug beta? This growth hormone beta, drug which acts on the growth hormone receptors. The drug which acts on growth hormone receptor is pegostromate. And what we have to monitor is RG. Pegostromate, and we have to interferon growth RGF 1 level. We have to monitor it in this patient. This is an pegostromate. Take a better. Move to the next question. During the war run, your senior officer asked you to interpret the significance of the low SOG ceremony, and a SOG is less than 1.1. So we need to which are the following condition would you best least likely? Least likely. It is saying least likely to be considered a differential diagnosis. Least likely. Which one of the following will not be the diagnosis among them? So, but at low SOG, less than 1 point. What are the commons? It will say biliary leak, nephrotic syndrome, pancreatitis, peritoneal carcinomatosis, and tuberculosis. These are the conditions in which there occurs a low SOG condition. These are the conditions in which there occurs a low SOG conditions. Here, biliary leak is given, pancreatitis is given, and hepatic metastasis. But whenever there occurs a hepatic metastasis, but of course, serum ascitic, serum minus ascitic fluid. When this liver metastasis occurs, liver will not function properly. So, of course, acidic albumin will be low, acidic protein will be low, it will cause a high SOG. So, massive hepatic metastasis is a condition of this high SOG, not low SOG. Question number 119. 42 present with chronic sinusitis. Oh, very good question. Beta, chronic sinusitis represent if stasis, hemoptysis, and a hematuria. Beta, here sinusitis means is an upper respiratory tract. Hemoptysis means lower respiratory tract, means lung parenchyma involvement, and they are having a cavitary nodules, rapidly progressive renal failure, vasculitis suspected based on immunosuppression. Here it shows a granular pattern. What are the diagnosis of this patient? Beta, in this patient, we have upper respiratory tract involvement, we have lung parenchyma involved, we have renal involvement, we have nodules are seen, in granulomatous nodules are seen. This all points towards a diagnosis of this granulomatous with polyangiitis beta. Granulomatous with polyangiitis. Why it is not microscopic polyangiitis beta? Because in microscope there are there in this microscopic polyangiitis beta, upper respiratory tract involvement is not here, and there is absent of this granulomatous inflammation. Why it is not an eosinophilic is because there is absence of this asthma, and eosinophils are not given in the option. So bronchial asthma and eosinophils will be always given whenever there occurs eosinophilic granulomatous. Why this is not in a cryobilinic vasculitis? It is usually seen in hepatitis C. It is not seen this pulmonary nodules at all. So, question number 120. A couple previously had a child with transfusion dependent beta thalassemia. Okay. Fetal DNA is obtained by chronic villancy. Use DNA probe identify inheritance mutant gene is shown in the which are the following technique is used. Oh, this is telling about a bit of which technique is used. If we see better clearly, suppose I don't know what this technique is. Let us read the option directly. Sometimes by reading the options, we can directly come to the answer. Is it antigen detection? Antigen antibody? Do you find any antigen on antibody? Antigen will be like this, antibody will be like coming this and finding antigen antibody complex. No, I do not find anything like that. So this will not be option. Is this an identification of the chromosomal abnormality by fluorescent? Fluorescence? We know better. We have seen the fluorescence. Probes described like a fluorescent in situ hybridization. We have seen how much colorful different color fragments like this. One is black color, one is red color, one is totally like this. Different multiple colors will be there in fluorescent. This is like this? No. Analysis of the cell surface markers during, do we find this cell surface? Do you find any cell like this and we have find any markers like seen in flow cytometry, like CD23, CD10? These are the markers. Do you find anything? No. There is a separation of the DNA fragment. If we see this is a DNA, this is a sequence of the DNA, and we have separated it into the fragment. If we see this is one fragment, this is 15 base and this is another segment. Clearly, these are some DNA is broken into some fragments. According to the sequence dependent the restriction site says better, this is clearly the sequence, this test is better sequence, DNA sequence better separation of the DNA fragment according to the sequence dependent. Here the option will be by does not by without knowing anything about this test, we directly come to the answer that this is the sequence based DNA test. A woman died due to septic abortion following Clostridium Welch infection. Which color of this postmortem hypo is likely a greenish brown color beta? Clostridium causes greenish brown color. Clostridium causes beta greenish brown. Which causes the bright pink beta? Bright pink is caused by hypothermia. Bright pink is caused by hypothermia. ठीक है? Bright pink is usually caused by hypothermia. And you will try to remember these postmortem color hypothesis in various conditions. To control the bleeding in hepatic, the surgeon puts a temperature near the origin of the common hepatic artery. Near the origin of the, in which of the following vessel the blood flow gets simple, clear, but it's just simple, beta. Now, why it is simple, beta? The common hepatic artery. This common hepatic artery, it gives beta. If we see beta, if we see a celiac, this is in celiac axis beta. This, suppose this is an aorta. Here this is in celiac trunk. In this celiac trunk, which there occurs a common hepatic artery. It gives a common hepatic artery. This is a common hepatic artery. This common hepatic artery, it continues as proper hepatic artery, which later divides into a right and left hepatic artery. So celiac trunk से beta common hepatic artery, it continues as proper hepatic artery and gives right hepatic artery and a left hepatic artery. This is one thing. This common hepatic artery, it gives right hepatic artery. It gives right hepatic artery. It gives gastroduodenal artery. It gives a branch known as beta one. Let me check this again. Okay, here. Yeah. This common hepatic artery, it gives a right gastric artery, and it gives again second branch gastroduodenal artery. This gives a two branch gastroduodenal. This gastroduodenal artery gives a right gastroepipolic artery and superior pancreatoduodenal artery. So common hepatic artery, it gives two branches, right gastric artery, and it gives a gastroduodenal artery. Common hepatic artery, it gives beta right gastric artery, and it gives a gastroduodenal artery. This gastroduodenal artery is further divided into, it gives two branches, right gastroepipolic artery, and it gives superior pancreaticoduodenal artery. So in this option, common hepatic artery, what it gives? Common hepatic artery, it gives right gastric, it gives right gastroepipolic, it gives right gastroepipolic, and it gives superior pancreatic duodenal artery. Does it gives right hepatic? Does it replace the right hepatic artery? No. It gives left. No. It gives a left hepatic artery. Yes, it gives left hepatic artery because it is an continuation. Here, common hepatic artery, it continues as proper hepatic artery, and then it gives the left hepatic artery. It is ideally a branch of common hepatic artery. So here the option will be 1, 2, and 5. ठीक है बेटा, राइट गैस्ट्रिक आएगी, कॉमन हेपेटिक से राइट गैस्ट्रिक आएगी, गैस्ट्रोड्यूडेनल आएगी, ड्यूडेनल से लेफ्ट गैस्ट्रोएपिपोलिक आएगी, सो राइट गैस्ट्रोएपिपोलिक आएगी तो राइट गैस्ट्रिक आंसर होगा, सुपीरियर पैनक्रेटिक ड्यूडेनल होगी। लेफ्ट हेपेटिक क्यों आएगी? बिकॉज common hepatic artery, it continues as proper hepatic artery and which further divided into this. Actually this is a common hepatic artery which divides into the right hepatic artery and the left hepatic artery. So left hepatic artery is also a part of this common hepatic artery. 26-year-old primary cardiac goes LSCS for fetal distress. After opening the abdomen, the reflecting uterine period, the surgeon places an instrument to retract the urinary, but a urinary bladder in LSCS is usually by the Doyne's retractor. It is usually by the beta Doyne's retractor. Morrison's retractor is used in beta laparotomy beta. laparotomy beta. It is used in laparotomy beta. ठीक है बेटा. And bell force is used in beta abdominal retractor. It is also used in laparotomy. So in LSCS, whenever LSCS comes, dryness retractor is most important thing. You will see in which of the following sites are such neuron. This is a neuron, and what this neuron looks like beta. अगर आप देखो बेटा, here this is a body. In this body, these are the types of neuron beta. Body से बेटा एक only one single process has started. It's a unipolar. From the body, there are two processes. This is known as bipolar. And from the body, one process and then suddenly it divides into two. It's a pseudo unipolar because only one process starts from the body, then it divides suddenly into just pseudo unipolar. And the multiple processes from the body occur. These are multipolar neurons beta. And the unipolar neuron beta, pseudo unipolar neuron is seen in this beta dorsal root ganglia. Pseudo-unipolar is seen in this beta dorsal root ganglion. Cerebral cortex has multipolar neurons. Cerebral cortex has multipolar neurons. Spinal cord also has multipolar neurons. Beta. Scorpius ganglion is beta bipolar neuron beta. Also known as beta. This Scorpius ganglion is also known as vestibular ganglion. Another example of bipolar is beta retina. याद रखना बेटा bipolar और unipolar याद रखना बेटा. Unipolar अरे this pseudo unipolar beta dorsal root ganglion is example. Bipolar is Scarpa's ganglion and retina. ये दो याद रखना examples. These are important. A child is diagnosed with diphtheria and diphtheria antitoxin is administered to him. After 10 days beta, he presents with a tracheal rash, abdominal pain, nausea, vomiting, palpable spleen. Which of the following state is not true about the type of hyperconsia happen? Because whenever the injection we have given him this beta any this what's called administration to his diphtheria antitoxin is serum. When did we have administered him beta antitoxin is beta serum. So after administering the serum, patient get a sick, patient gets reaction. This is known as beta serum sickness. What is serum sickness? Beta serum sickness usually appears 1 to 2 weeks after administering serum. So when we administer the serum and there occurs a reaction to this beta, this is known as beta the serum sickness. And the serum sickness is beta. It is an example of this beta type 2, type 3 immune mediated reaction. Here are the mnemonics you can remember better. Sharp is a mnemonic for serum sickness. Serum sickness is a type 3 immune mediated reaction. It is a type 2 hypersensitive reaction. So this one is the wrong option beta. So this is a systemic form of hypersensitivity. Yes, it is a systemic form. It can be following injection of the penicillin. Yes, and single injection can cause hypersensitivity. It is not a type 2. It is a type 3 hypersensitivity reaction. A baby has a recurrent. So better. The baby has a recurrent fracture than hepatosplenomegaly. X-ray show different increase bony densities with bone-in-bone appearance. Now, if you don't know any diagnosis about this thing, now let us come to this option directly. Will there be a hydrocephalus? Maybe, because we don't know the diagnosis. Will there be a hypercalcemic crisis? Hypercalcemia, there may be bonus, gronus, stonus. That's not an option. Will there be a thrombocytopenia? Will there be a facial neuropulses? We all know nothing. We don't know anything about this case. But still, because there has a recurrent fracture. When the patient has a recurrent fracture, means this patient must be having a hypocalcemia. The bones are not well formed, so that is why this patient have a recurrent fracture. Though it patient cannot have a hyperkalemic sepsis. Hyperkalemic sepsis spells understand bonus, gonus, dehydration at all. So that's not a case. So by knowing just one option of this, we can directly come to answer. This is better case of infantile osteopetrosis. osteopetrosis. Others are no need to remember this at all, but just to the basic concept, basic understanding that osteoporosis will be there. It will be a hypocalcemia, but not a hypercalcemia, because recurrent fractures are there. So that is how you came to the answer to this question. HIV patient present with fever, weight loss, cough and hepatosplenomegaly and pancytopenia. HIV patient present with this must be there might be some fungal infections at all happening. He presently exposed bat. The exposures to the bat, whenever there are some exposure to bat, bats usually cause the histoplasmosis. Let us see the option. Which are the following microscopic findings are characteristic of the organism? So histoplasmosis is used by the caused by the bat infected colbus. So small oval yeasts from forms inside macrophages, broad-based budding yeasts, large spherules containing endosphere, encapsulated budding yeasts. Let us see better how this histoplasmosis appear. Small oval-shaped forms inside the macrophages. Yes, better. In the histoplasmosis, there are trivial oval cysts with narrow-based bindings within the macrophages. These are like this beta, small oval-shaped cystis, tiny cystis surrounding small oval yeasts forms inside the macrophages. Inside the macrophages, small oval cystis are this is characteristic of this histoplasm. Broad beating budding yeasts look like a figure of 8. This is usually seen in case of blastomeres. Large spherules containing endospheres is usually characteristic of this beta coccidioides. And encapsulated budding yeast with a clear halo is a feature of this beta cryptococcus. Is a beta feature of this cryptococcus. So small oval yeasts forms inside macrophages. If you better see the images of these beta, kindly see the pearls related to this beta. You will see the images of the small oval yeasts uh, in the histoplasmosis. The broad-based budding yeast will be seen in the blast. Please try to remember all these four. They are high yield, high yield. Try to remember this line. Small oval yeasts, small oval yeasts from inside macrophages is a characteristic feature of this histoplasmosis. Broad-based budding yeast. Whenever you see this line, always think about this blastomycosis. Large spherules containing endospheres. This is seen in this coccido. This is seen in beta coccidioides. This will be like this beta coccidioides will be like large spheres containing this large sphere beta एक होगा इसके अंदर small sphere endospores होंगे बेटा ऐसा. This is a feature of this coccidioides. ठीक है. I hope बेटा this will help you. And this is in feature of this बेटा. अगर हम बेटा figure of 8 देखेंगे बेटा, this is in figure of 8 broad based budding yeasts. This is blastomycosis. And beta if you are thinking about this histoplasmosis, then this will be like this beta small tiny oval cystis beta. It will be like this, tiny oval cystis. It will be like this. It is seen in this histoplasmosis. And there will be a thick cystis similarly to like this. There will be a round thick wallet. This is a thin wallet. Histoplasma has a thin wallet cystis. And what about this? A patient has a thick wallet cyst. Patient has a thick wallet cyst, then this is a paracoccidioides. If patient has a thin wallet, small oval shaped, and a large thick wallet, round thick wallet cyst is better, with having a neck, narrow neck, which patient is having a neck. Here the neck is not seen. This is paracoccidioides. Now, a 28-year-old man with a poorly controlled bronchial asthma, or patient has a bronchial asthma, 1 point, presents with recurrent wheezing, okay, and expectoration of the brownish mucus plugs, okay, patient having a mucus plugs. Lab investigation showed eosinophilus serum IgE level is greater than 1500, higher than HRC temperature station. What is the most likely diagnosis? But this is a characteristic of allergic bronchopulmonary aspergillosis. Here the criteria for this is seen in beta bronchial asthma patients and cystic fibrosis. patients will be having a bronchial on cystic fibrosis. Or point number second, there will be a central bronchiectasis. That is a characteristic of this. There will be a central bronchi. If we see better here, there is a dilatation of this bronchi. Dilatation of this bronchi. This is in central, not peripheral. This is seen the central. Central. This is known as beta or proximal bronchiectasis is characteristic of this. And the point number third is the mucus plug is beta. If we see the bronchi beta, here is a white structure which is filling the this or mucus which is filling them beta bronchi is known as the hyper intensity mucus plug. This is an hyper highly specific sign for this allergic bronchopulmonary aspergillosis. And beta one more thing, the eosinophils, it should be better more than, they should be better more than 1,000. They should be better more than 1,000. Eosinophils should be more than 1,000. I'm again combining them better. One, it should be in bronchial asthma or cystic fibrosis. Second, there should be a central bronchial tasis. Third, there may be a hyper intensity mucus plug. This is highly specific. This is characteristic, this one. And fourth one, that is beta IgE level should be more than 1,000 in this patient beta. One more thing. A medical officer in a malaria endemic area is trained field worker to identify mosquito vectors. Okay, he has to identify mosquito. Now, what are the characteristics of the female Anopheles mosquito? Go and try to remember this beta. Female Anopheles mosquito beta, they have supported wings, and this patient has a supported wings beta, and Anopheles mosquito tends to sit with their head low. The head is low beta, and they are reared and raised. The reared end is raised beta. This is head, and their hair and raised. That means this body is an angulated body. Just try to sit in an angulated body beta. The body is pallid, no. The body rests at an angle beta. The body rests at an angle with the surface beta. 31 old male present with a male this presents with a what's known as enlarged testes. Ultrasound shows homogeneous hypoechoic mass which label normal AFP and has an elevated beta HCG based on the provision micro. Here beta, if we see the microscopy, there are characteristics of this fried egg appearance. Fried egg appearance is seen. Fried egg appearance is seen in this beta with in this biopsy beta. Fried egg appearance in the biopsy in the testis is seen in beta. Seminoma is seen in seminomas beta. In the seminoma beta, here we see in the seminoma AFP is absent, beta SCG will be positive. Now let us see AFP is absent. In this patient, their patient have a normal AFP. Absent means normal AFP and elevated beta HCG with fried egg appearance. This constitutes beta diagnosis of this seminoma. In this seminoma beta, there are the findings of this beta markers of the seminoma beta. You will clearly see this patient has flap kit OCT3 4 positive or podoflane positivity. Please try to remember this beta. Seminoma as OCT 3/4 and KIT positive. These are the markers for this seminoma. These are the markers of this seminoma beta. Okay, beta. If a patient has patient AFP positive and cytokeratin positivity is seen in yolk sac tumor, beta. And here the patient has CD30 OCT3/4 and cytokeratin positivity. CD30 positive with cytokeratin positivity is seen in beta embryonal carcinoma. Try to remember this beta. Seen in the embryonal. ठीक है बेटा. Try to remember this embryonal carcinoma. ठीक है बेटा. I will repeat this beta. The markers you have to remember beta. Markers you have to remember for this beta. ठीक है बेटा. Seminoma. For seminoma there are flap, kit, OCT, 3/4 and photoplane. Actually try to remember flap, kit. These two markers are photoplane markers. For this what's known as a yolk sac tumor, there are AFP positivity, glypican 3 positivity. ठीक है बेटा. yolk sac के लिए AFP is positive and there are glypican positivity. For beta embryonal carcinoma, CD30 positive and there occurs cytokeratin positivity. Cytokeratin positivity. ठीक है बेटा. Structure is marked in 1 to 3 paranasal sinus below. Which of the following given structures does a nasorectal and duct opener? Now first we should know the structures. Structures marker beta. This mark one is no beta inferior meatus. Inferior meatus. Option number 2. This is an inferior turbinate. Option number 3 is middle meatus, and this is an middle turbinate. So in the inferior meatus, which opens beta nasolacrimal duct. Nasolacrimal duct opens in the inferior meatus. Rest others beta. The other one is maxillary, frontal, anterior ethmoidal opens into beta. Maxillary, frontal sinus, and anterior ethmoidal sinus. These opens in the middle meatus. In the inferior nasolacrimal duct याद रखना बेटा. NLD nasolacrimal duct opens in the NLD means lower. L याद रखना. NLD lower and downwards. Nasal lacrimal duct lower and down. Try to remember it is opening in the nasal lacrimal duct. Okay. Question number 130. 40-year-old male presented with the recurrent episodes of colicky abdominal pain radiating to the groin. CT cube shows patient has a multiple renal calculi beta. Metabolic reviews, patient has hypercalciuria beta. Patient having had the physician starts a drug that decreases the urinary calcium excretion. Which of the drug beta? कौन सा drug है जो urinary calcium decrease कर सकते हैं बेटा? देखो, we know the loops diuretics, they lose calcium. Once they lose the calcium, that means this calcium will go into urine and they will cause hypercalciuria, and they can cause nephrolithasis beta. So lupus lose calcium. So loop diuretics cause hypercalcium. They can cause nephrolithasis. But question is saying that physician starts the drug that stops this hypercalciuria. That stops. So another drug, hyzide is beta. Hyzide is caused because they cause increased calcium absorption. They cause increased calcium absorption. Once they cause absorption from the urinary tract, it causes absorption from the urinary tract into the blood. They can cause hypercalcemia. They can cause hypercalcemia, but they decreases hyper कैल्शियूरिया. यानी बेटा यूरिन में कैल्शियम ये कम करेंगे. When is they decrease the urine calcium, urinary calcium, they decrease the chances of this nephrolithasis. They decrease the chances of calcium deposition in this urinary tract. They decrease the chances of nephrolithasis. That is why thiazide drugs are used in the nephrolithasis. Thiazide drugs, as we know, beta, they act on DCT, and in DCT we have sodium chloride co-transporter. sodium, potassium 2, colloidal throat monosphere. This is seen in thick ascending lip of loop of Henle is beta, and this is an action point for loop diuretics. ठीक है बेटा? So in this case, thiazides are used in hypercalciuria. This is a term beta. Hypercalciuria यानी यूरिन में कैल्शियम ज्यादा है तो which decreases thiazide is decreased, which increases urinary calcium. यूरिन में कैल्शियम कौन इंक्रीज करेगा? It is caused by the loop diuretic, which decreases urine calcium, that is thiazide. Vice versa is seen with the blood. Which increases blood calcium, that is thiazide, because they increase absorption. जो यूरिन से निकाल के ब्लड में लाते हैं, ठीक है, इंक्रीज एंड लोग उसके साथ उल्टा होगा बेटा. 20-year-old man with a history of intravenous drug use presents with a fever for 6. The temperature itna on examination new systolic blood is heard. Transthorax echography shows oscillating mass attached to the tricuspid. Blood culture अभी blood culture नहीं हुई है. No alternate diagnosis. According to modified Dukes, which are the following is the most appropriate interpretation. Most appropriate interpretation, beta, which is there. Here this echocardiogram shows oscillating mass attached to the tricuspid value. Now, which among the Dukes, what Dukes criteria says that? Dukes criteria says the definitive infective endocarditis possible and rejected. Definitive is when we have a two major criteria or one major, three minor criteria or five minor criteria. Does anyone fits two major criteria? What are the two major criteria? What are the major criteria? Major criteria, beta. These are the major microbiology. Positive blood culture. Does we have a positive blood culture? No. Positive blood cultures are pending. Second, imaging. This echocardiography may showing some significant valvular regurgitation or mass is there. Yes, we have a one major criteria because echocardiography shows oscillating mass attached to the valve. Oh, there may be a murmur is there, mass attaching to this. This is a one positive. That means imaging evidence is there. We have a one positive major criteria. Now we have any minor criteria. Temp- this patient presents with fever. Yes, we have one minor criteria. We have a one major criteria and we have one minor criteria only in this patient. Rest we don't have. So this patient fits in one major criteria, one minor criteria. This patient fits in the possible infective endocarditis. This patient fits in possible. ठीक है बेटा. This patient fits in possible infective endocarditis. Beta, you should know what are the major criteria and what are the minor criteria. For that, blood culture should be positive, lab test should be positive. These are the microbiological culture. Among the imaging, you should have an imaging criteria. For the majors ones, please try to read. For the minors, we use a timer, mnemonic. T for temperature, A means immunological, M means beta microbiological criteria, A means emboli means vascular and ठीक है बेटा R means risk factor. These are the minor criteria how we use. ठीक है बेटा minor criteria हम टाइमर के जरिए याद रखते हैं. R is risk factor. ठीक है बेटा. A means embolic. ठीक है बेटा. M means microbiological are both major criteria as well as the minor criteria. Please try to remember and try to read this whole positive blood cultures, positive lab culture. These are the microbiological cultures and imaging ones. So if patient has a one major and one minor criteria only, it fits in the possible. Definitive for definition, we need a one major and a three minor or two major or five minor criteria has we need in this patient. This is not fitting in the definite infective endocarditis because we have only one major criteria and the fever is there. We have only one minor criteria, so that's why we will go for better with possible infective endocarditis. Now 134 20-year-old male presents with fever, migratory polyarthritis, pustular second lesion following untreated urethritis. So patients have a urethritis. Blood culture is negative, but the urethritis was gram-negative intracellular diplococci. Gram-negative intracellular diplococci is beta gonococcal infection. Which virus factor helps them to respond for attachment? Attachment कौन करता है बेटा? The attachments for gonococcal is बेटा via the P this pili. Gonorrhea beta is a non-capsulated. It is gone. The capsule is beta feature of this meningitis. These are two: Neisseria gonorrhea and meningitis. Gonorrhea is a non-capsulated. Go no. Gonorrhea means go no. No capsule. No capsule. Gonorrhea में कोई capsule नहीं होता बेटा. It is non-capsulated. Neisseria gonorrhea बेटा go no means non-motal. याद रखना बेटा. Gonorrhea no capsule. नो मोटाइल बेटा, ना ये मोटाइल होता है ना प्लेजर हेल्पस इन द मोटालिटी बेटा, मोटाइल भी नहीं होगा, ये भी ऑप्शन नहीं है, कैप्सूल भी नहीं होता, कैप्सूल मेनिंजाइटिस में होता है, मेनिंजाइटिस बेटा होता है, एक्सोटॉक्सिन ए एक्सोटॉक्सिन बेटा सीडोमोनास एरिजिनोसा प्रोड्यूस करता है बेटा, सीडोमोनास ऑरिजिनेसा बेटा, ठीक है, तो ऑप्शन विल बी द पाइलाई. Again, 35 no, 24 old, question number 135, is working in the electroplating industry. We brought to the emergency confusion and taking following sudden collapse. But it had a sumela bitter elmon, beta sumela bitter elmon. याद रखना बेटा, this patient has a bitter elmon smell. Balancing shows severe lactic acid. Which of the following enzyme is inhibited? First, you need to find which toxin has a sumela bitter elmon. Sumela bitter elmon is toxin of the cyanide beta. If we see beta here, similar bitter element, it is an cyanide, it's caused by cyanide. Now if we go for the electron transport chain, which inhibits this cyanide, which inhibits the electron transport chain, it inhibits the complex 4 beta, it inhibits the complex 4, and complex 4 is cytochrome oxidase beta. Complex 4 is known as the beta cytochrome oxidase. Succinate dehydrogenase complex 2 beta, ठीक है, ठीक है बेटा. No. Given following the procedure is Nalgonda technique. Nalgonda technique, beta, what is the purpose of this technique? Please try to remember this flow chart in which we are doing this Nalgonda technique, because this was a neat PG 26 25 beta paper, and this Nalgonda technique is used beta for removing fluoride components from the water. It is used for the defluorination of the water. Try to remember this. And the sign shown in this ultrasound figure is seen. Better try to remember better. This is a normal lung beta. This is a normal lung, and this is a pneumothorax lung. Here, if we see there is a normal pleural marking beta. Here there are multiple these small white. Okay, and how you will see beta, how you will see on the M mode, you will not clearly appreciate this on this finding. Now if we see beta on normal beta, on normally a normal lung, you will see the upper part and the lower part, it looks like a seashore sign beta. Here, like these are looks like a water body, and this looks like a sand. Normally beach पे बैठे हुए है बेटा. Try to remember the Goa beach. In the Goa beach, here you find a sand, and here you find a water. See, this looks like that. Here this is in sea, water waves, and this is the sand. This is a sand. This sand looks like a seashore sign. That is a normal phenomenon. Oh, remember the गोवा, आप गोवा में बैठे हुए हैं, बीच पे बैठे हुए हैं, सैंड और वाटर है बेटा, ये नॉर्मल फिनोमेनन. बट अगर आप दोनों में पानी है, इधर भी पानी है इधर भी पानी है, दैट मीन्स आप डूब चुके हो किसी में. दिस इन दिस here, this is waves, here there are also waves. This is known as barcode sign or stratosphere sign. This is the characteristic of this. Here if we see in the image, divide is half and half. Here normally these are the waves, this is in sea, and there normally there should be sand, but sand is not there. Here again these are waves, it looks a barcode sign or a stratosphere sign beta. This is a sign of pneumothorax. 138, 60-year-old female presents to the OPD with asymmetrical nevus, beta nevus, and with irregular margins and variegated aneurysm. Recently, the nevus had become purer. The histopatacal because nevus में होता है, there is a melanin seen in the nevus. Nevus में melanin होता है बेटा. This pathological examination of lesion is shown below. Which stain is used for this melanin? It is beta Messinus fundus stain. And vein Gisson stain is used for this collagen. ठीक है बेटा. ठीक है बेटा. So in the nevus we will find this melanin here, and for the melanin, Messinus fundus stain is used. What is the most specific for this melanin? For the most specific stain for melanin is dopa stain beta. Most specific is for melanin is Messinus trichome stain. It is used for beta. Again, it is for the connective tissues. It is used for this connective tissues again beta. It is again used for the connective tissues. Mishicormin stain it is used for the cryptococcus capsule. Cryptococcal capsules. ठीक है बेटा. It is used for the cryptococcal capsules. Here the image is given. Histopathological image is given. Here these fragments. These are the melanin pigments. These melanin gets deposited in the condition known as nevus condition. Gout. A 50-year-old female with a gout complains of acute onset redness of the eyes as given below, which is not associated with, yeah, better, which is not associated with pain. This is an important feature. Eye condition not associated with pain. She gives a history of multiple visits to hospital with same condition. What could be the diagnosis, beta? Can it be epicellaritis? Can it be a scleritis? There are two because it's not a cyst. It doesn't look like a cyst. Now, either it is an epicellaritis or it is a scleritis. Scleritis is beta usually associated with pain. Scleritis में pain होता है beta. Scleritis is a pain. And what about this epicellaritis? Epicellaritis is usually not associated with pain. Now, if for a nodular epicellaritis and diffuse, it will involve the whole of this area, whole the area. Here, if you see it's a localized area, and there is it is localized area, and there is something this fat-like nodule is here, and this. So I will go with the nodular epicellaritis, not diffuse epicellaritis, because diffuse epicellaritis it should be covering the whole area, and there is a white this redness throughout the whole areas. Another question here, 140. A 45 or 65-year-old female develops a sudden hypoxemia. Patient has sudden hypoxia on the second post-operative day to following abdomen. He has a shallow breathing. Now patient has a shallow breathing due to pain and difficulty in clearing secretion. The chest excretion, which are following best treatment, weak abnormality. In this chest X-ray, you will see beta here this portion. It looks like a triangular whitish appearance. Triangular chords. It is also a triangular seen in the lower lobe collapse. Right lower lobe collapse is seen beta in this patient. This lower lobe collapse, right lower lobe collapse occurs because inability to excrete the secretion. There occurs a bronchial obstructions. Because of this obstruction to this area, the air is not flowing in this area. That is why this lobe collapses. However, there is no abnormality to the vessels beta. Vessels have no abnormality because this is in post-operative. This is a type 3 respiratory failure which usually occurs in the post-operatively. Type 3 respiratory failure. In type 3 respiratory failure, what are the this ventilation is usually absent but blood flow is present. Ventilation वेंटिलेशन बेटा एब्सेंट है. क्यों एब्सेंट है? in this area ventilation is absent because of obstruction, because of mucus plugging, which is difficult to expectorate because patient has a pain. He is not able to expectorate. He is not able to this excrete this secretions which are collecting inside this bronchi. That is with ventilation is absent here, but we don't have any issues with this vascularities in the area. So in this patient perforation is present but beta ventilation is absent. This is the finding of uh, Main finding beta, which is seen in V by Q mismatch abnormality. Perforation is present and ventilation is absent beta. It will be the answer to this question. Ventilation nahi hai beta, ventilation is present. So how ventilation? Because it got collapse. When the collapse this, when there are no alveoli in this area, how can there be a ventilation? Both ventilation and perfusion is because there is no abnormality of the vessels. Why there can be perforation issue? Okay. You visit a crime scene after disappearance of the VIP and her dog. You see the stains like these. These are the blood stains clearly. Now you will see following the test to get more clues. Except which another following tests you will not do on the blood. So beta, we have divided tests into tests for seminal stain and tests for the blood stain. Among the following beta, if we see beta, among these, the acid phosphatase test is for the seminal stains. Acid phosphatase stain is for the seminal. You have to remember better this list. Acid phosphatase stain is used for the seminal stain, not the blood stain. Here in blood stain, we cannot do acid phosphatase test. A 45 this 45-year-old man is started on a drug X. Okay, drug X पे start किए with rapid therapeutic plasma concentration. The target plasma concentration here, the plasma concentration is 12 mg per apparent volume of distribution is 0.5 mg per kg, and the patient weighs 80 kg. The oral bioavailability of the drug is 6. What is the loading dose of the drug? Beta loading dose. How can we can calculate the loading dose? This is the formula. Beta for loading dose we need to do target concentration, volume of this apparent volume of distribution divided by bioavailability. What's the target concentration? Target concentration is beta 12 mg per liter. And what is an volume of distribution? Volume of distribution 0.5 liter per kg. So total volume of apparent volume of distribution will be 0.5 into 80 because this man weighs 80 kg. This man weighs beta 80 kg. So it will be 0.5 into that will be 40 liters. So apparent volume will be 40 liters and bioavailability is 60%. 60% means it is 60 by 100. That means it is 0.6. It is 0.6. So let us fit all these data in the formula. Loading dose will be beta. Target concentration will be 12 into beta. Apparent volume of distribution will be 40 divided by 6. 0.6, that will be approximately beta 800 mg. Okay, just by knowing the formulas you will try to answer, you will be able to answer this question. And doing a per vaginal examination of abdomen, you were able to palpate the mouth with hard alveolar margin, nose, malar. I mean, in a PV में आपको face structure देखेंगे. So definitely this patient will be having face presentation. Now the engaging diameter of the face presentation will be better. If we see for the face presentation, engaging diameters are submentovertical or subbrachmentovertical diameters. Submentovertical will be the engaging diameter of this area. You have to remember better this table. Now, which are the following findings you would not see in a patient with a central cord syndrome? For the central cord syndrome, beta, if you see beta, suppose this is the beta spinal cord. If we see beta dorsal column tract, they go like this. They are not crossed at this level, and the spinothalamic tract they come like this and they cross opposite side and then go upwards. Dorsal column tracts they usually carry with proprioceptions. Dorsal column tracts beta they usually carry fine touch proprioception and vibrations. These are the dorsal columns. They go dorsally without crossing the opposite side. In the central canal, beta, so in this beta, in the central canal, problem is in the central area. When there is a problem, the dorsal column is here, it goes like this. So it does not affect this dorsal column tract. It does not affect these dorsal column tract. However, this will affect this spinal thalamic tracts, those tracts which cross towards the opposite side. What are the what these spinothalamic tracts? They carry beta pain fibers. They carry crude touch fibers. They carry beta temperature with them. So in central canal syndrome, beta, these spinothalamic tract will be affected. So the patient with the pain, crude touch, and temperature, this patient they will be affected. But beta, this patient, the fine touch proprioception will be intact. That they will not have any problem regarding the fine touch proprioception and vibration. So beta, question is saying which of the following would not be seen, would not be, which of the following is not a feature? Vibration sensation over shoulder, lower neck, and upper trunk beta loss, it not be a feature because they have a preserver feature of these vibrations. Because vibration is a beta, vibration is loss of vibration sense over shoulder, lower neck, and upper back is not seen in central canal syndrome beta. Kyun beta? Because this is not affected in central canal area. We know the legend is far away from the tract which carries these fibers. That is why this is not a feature of this. तो बेटा ये पोर्शन affected नहीं होगा in central canal syndromes में, because dorsal column fibers carry vibration sensations and the vibrations will be intact. They will not be lost in central canal syndrome patients. They will be intact, and this intactness of this vibrations send us in areas in shoulders, lower neck, and upper trunk is known as a cape distribution. Is known as beta cape distribution. Here, this is a preserver, not loss. Which of the following is an advantage of the Elizaro's external fixator? What is an advantage, beta? No neuropulse? No, there can be a neuropulse because we are putting the pins and large various pins, beta. We are putting inside the bone, so no pulse can be there. Correction is by multiple operation. No, beta, it's a single operation. It is a single operation. It is not a multiple operation, beta. Immediate load bearing, yes. Does not hamper hormone. Yes, it hampers beta hormonal activity. It hampers hormonal activity. It hampers beta hormonal activity. Which are the following is an advantage of? Advantage beta इसमें है immediate load bearing can be done. Correction is by multiple. No, it is a single operation beta. Neuropulse is there beta. It hampers daily activity. It hampers beta. Here I have seen the advantage and disadvantage beta. Immediate load bearing is done. More than one problem can be corrected by one stage operations. That is, these are advantages and disadvantages of this L0, and this is the most stable, right? Remember this, but it's the most stable. Antibodies associated with chronic hepatitis and hepatitis C and hepatitis D are respectively. Try to see this table better. Chronic hepatitis C anti-LKM1, chronic hepatitis B anti-LK LKM3 1 and 3. Here 1 and 3. Option D will be the answer better. Try to remember this. LKM2, LKM1, 2 and 3. 1 is seen in hepatitis C, 3 is seen in hepatitis D, 2 is seen in drug induced. This is an important thing to remember better. 140C beta. A young woman present with complaints of beta. Patient has a complaints of dysphagia, recurrent abdominal pain, dysphagia, recurrent abdominal pain, with nausea, feeling of hardness over the left hand or past 2 years. She reported that she's constantly worried. She is worried about her symptoms. Worried about her symptoms. Try to, which I am highlighting the point here is important. She has a multiple hospital visits where detailed workup has not been able to find any cause of her symptoms. She looks anxious with her irritable effect. What could be the possible? This patient has an illness anxiety disorder. Let us see. Does patient has a factuous disorder? Does patient have a delusional disorder? Or this patient has somatic symptom disorder? We will try to explain all of them. Patient having illness anxiety disorder. In this patient beta, patient have a minimal symptoms, but She is convinced he has anxiety that she may be having some high problem. Suppose this patient has sometimes abdominal discomfort, mild, but she may be thinking that she has cancer. Continuously, she may be having cancer. That is known as illness anxiety disorder. Minimal symptoms, but but she is thinking that he has a big problem. So, in illness anxiety disorder, patient has minimal symptoms, but patient thinks she has cancer, the big problem, but there are minimal symptoms. Okay. Now, in patients which have a somatic symptom disorder, in patient which has a somatic symptom patients, the patient has significant good symptoms. Patient has good symptoms. Patient has significant symptoms. In illness and a patient has minute symptoms, but in somatic symptom disorder, patient has a good, like patient has dysphagia, patient recurrent abdominal pain. This patient has pain. Patient has dysphagia. In this patient had a good enough symptom, but she continuously thoughts about them, and these gives anxiety to her. This is a major difference between illness anxiety disorder. In illness, patients has a minute symptom, like patient may be having a cold, she will think that she has a brain tumor. She always thinks them that she has a very big problem in illness anxiety disorder. However, in somatic symptom disorder, the patient have a symptom, but she will exaggerate them. That he has a recurrent abdominal pain. If she may be having a recurrent abdominal pain, for example, 1 to 10 scale, having a 5, but she will say that she has a 10. She will say she has a grade of 10. So she will exaggerate these somatic symptoms in this patient. However, in infectious disorder, this patient does not have anything. She will lie that she has a problem. That is something known as the infectious disorder. Delusional disorder, they have a firm belief that patient has something, 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 something. She may be having, she may be stick to one thing. That means उसको है कुछ तो कुछ है. There is something, something. For example, if she will say there has a tuberculosis, so if you try to explain her anything, do multiple tests, she will always think about tuberculosis. She has a delusion, firm false belief of something. The fixed belief. Okay, I hope the segment illness anxiety disorder. Her patient has a symptom, very less symptom, but she may be taking them in cancer or some sort very big problem. In somatic symptoms, patient has symptoms, but she may be telling them exaggerating more than 6 weeks. For example, dysphagia, recurrent abdominal pain, feeling of falling. There are multiple symptoms in this patient. That's why this is a somatic symptom, not illness symptom disorder. She is worried about the symptoms. This is an important thing. She is worried about her symptoms. In somatic, there may be symptoms, and patient is continuously worried about the symptoms. This is characteristic of somatic. In illness, patient have a symptom, but she may be thinking about a disorder. She have a big diseases. Patient has symptoms, minute symptoms, but she may be thinking of they had a cancer at all. Okay, beta. The axillary skin freaking question number 140. In summary, I will be telling that in somatic and in illness, here the patient has symptom. Here the patient has minute symptoms, and patient is thinking of some diseases based on. He'll be thinking of diseases from these symptoms. There is कोई disease है, बड़ी disease है, cancer at all. In somatic, he will be continuously thinking about these symptoms. कुछ बड़े symptoms है ये. He will be thinking about symptoms. Okay, 148. The axillary skin finding is shown in this image. Noted 6-year-old man being evaluated for gastric cancer. Okay, this patient is evaluated for the gastric cancer. A biopsy from the involved skin would most likely histological. There is beta disease, this is acanthosis nigricans, gastric adenocarcinoma. Beta, it shows hyperkeratosis and papillomatosis. Beta, acanthosis nigricans. If we do the biopsy of this patient, acanthosis nigricans shows hyperkeratosis and papillomatosis. And if we show melanocytic hyperplasia is seen in beta melanosis, actinic. It is seen in a condition known as actinic melanosis. It is seen in a condition known as actinic melanosis. ठीक है बेटा, because there is only two close differentials among them. Full thickness epidermal ATP, no, it is seen in cancer. Dermal mucin deposition. Dermal mucin deposition is seen in cutaneous mucinosis. No, the close differential is, will be what are the acanthosis nigricans, what are the histopathological image findings. It is in beta hyperkeratosis, not hyperplasia. Hyperkeratosis will be there. Hyperkeratosis. The melanosis hyperplasia is seen in actinic melanosis. Actinic, याद रखना बेटा, melanotic hyperplasia is seen in actinic melanosis. Actinic melanosis is a condition in sun-damaged skin, and hyperkeratosis is seen in actinic this acanthosis nigricans. Here the female, 46-year female, it is come to emergency department with painless, rapidly growing lesion over the skin. Lesion biopsy shows a small round blue cells, salt and pink, neuroendocrine beta. It's a tumor arising from skin, which is a neuroendocrine tumor. And a neuroendocrine tumor which arises from the skin is Merkel cell tumor. It's a beta Merkel cell tumor. Because why it is a neuroendocrine? Because small round blue cells and salt or paper chromatin, these are the beta characteristics of neuroendocrine tumors. And neuroendocrine tumors skin से जो arise होता है, that is a Merkel cell. And what are the markers for this? But try to remember this table, most important table. CK7 negative and CK20 positive. This is seen in colorectal and Merkel cell carcinoma. CK7 positive, negative, and 20 positive. This is seen in Merkel cell. Try to remember better this. Both negative, these are hepatocellular carcinomas, prostate carcinoma, SCCC, RCC, prostate cancers. These are seen in, these are negative, and we both are negative. CK7 negative and 20 positive, only two conditions, colorectal, Merkel cell. Try to remember this paper. Try to remember this table. Most important table. Every year they ask questions from this. Try to remember the examples. At least try to remember these two. Question number 150. 20-year-old man have a type 1 diabetes mellitus present with vomiting, deep breathing, and positive urine Rothor's test. His breathing has a fruity. Oh, this patient has a fruity. That means it has a diabetic ketoacidosis, which biochemical event produce a volatile compound responsible for this breath order. That means we are telling that he has a fruity order. Why fruity order occurs in DKA patients? Because better in patient DKA, there occurs synthesis of the ketone bodies. What are the ketone body synthesis? They are acetoacetate. The ketone bodies which are synthesized in this patients are acetoacetate and acetoacetate and beta hydroxy butyrate. These are the two ketone bodies which are seen in this ketone body. These are the major ketone bodies which are formed in diabetic ketoacidosis. In this, among the ketone bodies, this acetoacetate, when this spontaneous decarboxylation of the acetoacetate occurs, it leads to convert spontaneously decarboxylation of acetoacetate occurs. It leads to production of this acetone, and this acetone causes the fruity color. This beta acetoacetate beta, it gives volatile component known as acetone, and this acetone has a fruity color. Okay, beta. So because it occurs a reverse spontaneous decarboxylation of the acetoacetate. When spontaneous decarboxylation of the acetoacetate occurs, it gives a component known as acetone. That acetone gives a fruity color. That gives a fruity color. That is important beta. That is why it is important. This reaction is important. The fruity color, the fruity order of this. I will repeat this question number 150. I will repeat question number 150. Question number 150, beta. A 20-year-old man with a type 1 diabetes presents with vomiting, deep breathing, and a positive urine Rother's test, beta. That means type 1 patient with positive urine Rother's test. It means that formed because Rother's test is used for detection of these ketone bodies. And if type 1 diabetes patients with vomiting, deep breathing, with fruity odor, that means this patient has a DKA, diabetic ketoacidosis. When this patient has a diabetic ketoacidosis, which amount of component produce a volatile component responsible for breathing, this breath order, fruity order, which component produces volatile? In DKA, beta, what are the ketoacidosis which are formed? There are two ketoacidosis, beta. One is acetoacetate, the another is beta hydroxy butyrate. Among them, beta, it is an acetoacetate which get a spontaneous decarboxylated into which get a spontaneously decarboxylation, beta, which get a spontaneously decarboxylated, and it releases a volatile component known as acetone, and this acetone gives and this acetone, beta, this is an acetone which gives a fruity color. So it is a spontaneous decarboxylation of this acetoacetate which gives this color. Okay, beta. What are the other options? Reversible reduction of acetoaceto beta hydroxy, no, beta. This does not give because it is an acetoacetate to acetone. Condensation of acetyl coenzyme with acetyl coenzyme. No, this is a formation of this is seen in this ketogenesis step. This is not ketone body action, no, beta. Try to remember this acetoacetate to acetone. This is the setup which gives, and it is an acetone which is responsible for protein color. So guys, let us start with the question number 151. A 6-month-old infant was brought in with failure to thrive. There's a recurrent vomiting, joints, and bleeding manifestation. The mother complains of, that's an important hint, the cabbage-like odor. The cabbage-like odor was seen from the body secretion. This is a hint given, guys. Urinary succinate acetone levels were found to be elevated, which are following metabolite is not likely to be affected. Another point which you need to clearly see, there is not to be affected in the side. So guys, what if you don't know anything from this, just by one point, cabbage like order from the body secretion, you know it is seen in tyrosinemia. It is seen by tyrosinemia type 1. It is seen in tyr it is seen in tyrosinemia type 1 disorder. So just by knowing one point, one hit point, this is the trick how you will solve the MCQ. They will give a large clinical history that you have to just pick up to one point. Just like this cabbage like order, go for with directly tyrosonemia. Now they are saying that which metabolite is not like to be affected. Now you need to go in detail where from this tyrosinamide, there is a defect in the tyrosine. Where from this tyrosine comes from? This is a beta amino acid derivative. We know that phenylalanine is converted into tyrosine. Tyrosine is converted into thyroxine. Tyrosine gives dopa, and dopa is converted into melanin. Dopa is also converted into dopamine. Each one is an individual question. Now, which one metabolite is not likely to be affected? Which one is not a derivative of tyrosine? Is melanin derivative of tyrosine? Yes. By directly or indirectly, melanin is derived, is seen in this pathway. Yes. Thyroxine, yes. Thyroxine is seen in this pathway. Can epinephrine be seen? Yes, epinephrine is seen in this pathway. Can melatonin is seen? No, melatonin is not derivative of the phenylalanine or tyrosine. This melatonin is derivative of tryptophan. This is how you will come to the answer. So, question number 152. A 52-year-old a patient presents to the dermatology clinic with tender. Listen to me, guys. It's a it is nodular lesions. Tender nodular lesions over the shin. Seen in this image, histopathology shows characteristics. There is a histiocytes with neutrophilic infiltration and a without vasculitis, guys. But these are some hints which are given. Tender nodular lesions over the skin. What is the most likely diagnosis? Let us see. Is it a sweet syndrome, erythema nodosum, Behçet's disease, or erythema nodosum leprosum? Let us see. What does this sweet syndrome mean? But this sweet syndrome is actually the febrile illness. It is an acute febrile illness, beta. Here, there occurs a tender subcutaneous nodules. There occurs also tender subcutaneous nodules. Nodules are also present here. Neutrophilic infiltrates are also there. The question says neutrophilic infiltrates, yes. Tender nodules, yes. But it also shows there are histiocytes and without vasculitis. These two features, guys, these two features are not seen in Switch syndrome. Otherwise, other three conditions are fit in this Switch syndrome. There occurs tender nodules, there occurs neutrophilic infiltration, there occurs nodules, but it's a febrile illness. The fever is not given in this patient. And the histiocytes and without vasculitis is a term which we have to focus on. The without vasculitis, beta, it's seen in erythema nodosum. Tender nodules without this vasculitis is characteristic of this erythema nodosum. There occurs in neutrophilic infiltrates, but histiocytes are also seen here. In Behçet's disease, there occurs a neutrophilic infiltrates, but there occurs a recurrent oral ulcer and genital ulcers. And erythema nodosum leprosum, it is beta, it is an immune mediated reaction, it's a type 2 lepra reaction. So whenever, guys, directly whenever you see a tender nodules on shin, go directly, it is 90% the answer will be erythema nodosum. But if they twist you on histopathology, they look at histocyte plus neutrophilic infiltrates. Histocytes, look at the histocytes, beta. The histocyte you will find, you will go for the erythema nodosum. Question number 153. Beta, the patient is saying is an unconscious state having suddenly collapsed. Cardiopulmonary resuscitation was done and there was no pulse. And ECG is given. No pulse with electrical activity. This is an ECG, shows clear-cut activity. This is known as pulseless electrical activity. This is known as pulseless electrical activity. Can we give defibrillation? Can you defibrillate it? No, never. Pulseless electrical activity and non-shockable rhythms are not giving shock. So defibrillation will not be the answer. Can we do amiodarone? It is also given in shockable rhythm. It is given in the shock. Amiodarone is a drug which is given in when we give a shock to the patients. So defibrillation and amiodarone are one and the same thing. What does it give? Can we give this atropine? Atropine is used in the bradycardia. Here, the patient is not a bradycardic. What is given? Then there is only one thing left, that is epinephrine. Actual treatment for pulseless electrical activity will be, guys, chest compression and give immediately 1 mg of epinephrine. But amiodarone is a drug which is given when we give shock to the patient. Even when you have a shockable rhythm, ventricular tachycardias, for example, VTs, these are the shockable rhythms. Not in case of pulseless electrical activities. 154. Patient undergoes a bariatric surgery. Guys, important question. In which weight loss results from reduced nutrition absorption. It is focusing on the mechanism of this the procedure, bariatric surgeries, the mechanism by which they cause the weight loss. There are beta two mechanisms mostly. One is beta. One mechanism is to reduce the gastric capacity. Reduce the gastric capacity. Suppose this is a stomach and we reduce its capacity. These procedures are known as beta restrictive procedures. And another thing is that this is a stomach and there are the small bowels. These small bowels play important role in absorption of the materials, and their length plays important role. For example, from stomach up to the large bowel, there is 100 meter, for example. These 100 meters are available for absorption of the food. Now, if we shorten this distance from 100 to only 10 meter, that means only 10 meter length is now available to absorb that much of food. So, if earlier we are able to absorb, for example, we eat a food and we are able to absorb 70% normally of this food. Suppose our 100-meter length absorbs 70% of the food. Now, we have only 10 meter left. How much food we can absorb? Hardly we can absorb 7 to 10% or something else. Hope you guys understand. Now we can absorb only 7 to 10% of the food. Rest of the food will be wasted. And if we get absorption of only 7 to 10% of food, from that much of food we have to use your energy, etc., for weight gaining. That is what we are actually decreasing our weight. So the procedure says the patient goes bariatric surgery in which there occurs a weight loss by reduced absorption. That means it is not done with this stomach portion. Something has been done with this intestinal portion. Now let us see. Can we do a gastric banding? Gastric banding, it is again dealt with the stomach. Nope. Band means it decreases the capacity. Nothing. Vertical banded gastroplasty, again stomach related. Sleeve gastrectomy, again stomach related, done. And what is left? Biliopancreatic division and duodenal switch. It is dealt with the small intestinal, and the small intestine is called reduced absorption. This is the simplest way to get the answer. 155 question number. In 1970, the World Medical Association adopted a resolution and therapeutic absorption known as. But how you will remember them, beta? How I remember them? Beta, absorption. Abortion means beta. Abortion. I used to remember this OBOR, abortion. So it will be a declaration of Oslo. What does the declaration of Tokyo? T for Tokyo, T torture. What does this declaration of Helsinki. It is concerned with H for beta human experimentations. And declaration Alma Ata, it's better, it's the general identified by PHC, primary health care or health for all. This is remember them better at during my preparation time. Moving to the next question. Question number 156. A 2 months old infant develops a profuse, but listen to me, guys. 2 months old baby with a profuse secretory diarrhea beginning in the first week of life. It's a neonate leading to dehydration, leading to metabolic acidosis and failure to thrive. Hint is that secretory diarrhea, and it's in first week of life. The diarrhea persists despite bowel rest. Diarrhea persists, recurring long parental nutrition. Small intestinal biopsies performed. Which microscopic finding is most correct for this condition? Let us see, guys. Let us see which microscopic condition it will affect. Villus blunting with cryptohyperplasia and increased intraepithelial lymphocytes. Beta first week of life, my lymphocytes, crypt blunting, hyperplasia. Can it be a celiac disease in first week of life? Nope. Intracytoplasmic inclusions in enterocytes with absent apical. I don't know. I don't know. Maybe this is an answer. I don't know. Transmural granulomatous inflammation with fissure ulcers. Crohn's disease. Fissure ulcers. Can it be a beta Crohn's disease? In fact, is it possible? Numerous foamy macrophages. Oh, pass positive bacilli. Whipple's disease. But as celiac diseases in infant, Crohn's disease in infant और Whipple's disease बेटा यहाँ पे absorption में कोई प्रॉब्लम नहीं है celiac disease iron deficiency anemia में absorption में इशू आ जाता है here it is in 2 months and it begins in the first week of life dehydration it needs a parental this nutrition so neither it can be a Crohn's disease because it will be a painful patient with present painful bleeding per rectum at all this is done macrophages these are there may be malabsorption issues gut issues and intraepithelial lymphocytes बेटा lymphocytes increase हो जाना मैच पर इतने ज्यादा lymphocytes बढ़ जाना within the neonate period I don't think this must be answer so what can be the answer by ruling out the option you will directly jump to this option beta intracytoplasmic inclusions in enterocytes with absent apical microvilli. This is a beta congenital autosomal recessive disorder beta. This is known as Deviation disease. Either you know this question or you don't know this question. You can skip this question because this is totally new for me also. Deviation disease beta. These are the conditions beta which you know. These are actually the histopathological points which you can remember. Villus blunting with cryptohyperplasia in the celiac diseases. The transmural granulomatous inflammation is seen in Crohn's diseases. Hemimacrophages is seen in the Whipple's diseases. And the rest in intracytoplasmic inclusions in anterior absent apical microvilli. Absent apical microvilli is seen in this Davidson disease and autosomal recessive and bigness in this infant. That is why with having a secretory diarrhea. So beta, I will go with this. ठीक है बेटा I will go with option B to this condition. Question number 157. The United Nations Development Fund program qualifies at development level via human development, on which of the following scales is the final human development index. Either it will be a 0 or it will be a 1. Simple. 0 to 1. Question number, ठीक है बेटा. Question number, 30-year-old woman underwent open umbilical hernia repair. There is extensive, it goes an umbilical this repair. There is an extensive dissection done in the subcutaneous plane, which of the following drain is used in the collection. Beta, these are the 4 drains given, beta. 1, 2, 3, and 4 drains. Which one of the following is used? Drain 1, beta. Drain 1 is beta. It is Jackson drain. Drain 2, it is simple drain, but it is a Robinson drain. It is an intra-abdominal drain. You have to differentiate this from this chest drain, in which there are some water seal level, beta. In this, there is no water seal. This is beta corrugated drain, and this is totally a different type of drain, beta. Use it for drainage of this abscess and at all. It is also used in hydrocele. This is known as beta Penrose drain. These are the four types of drainage beta which you should know. The Jackson Pratt drain, it is beta used in hernia repair, head and neck, and axillary dissections. Remember this: hernia, head and neck, and axillary dissection. Jackson Pratt drain is used beta. This is an abdominal for intra-abdominal surgeries. Corrugated drain is beta. It is used for, actually, these are the open drainage. Both sides are open. These are used for drainage of this abscess and cavities. So option for this open umbilical hernia or the hernia, it will be option 1 will be the answer. G4P3 mother who conceived via artificial this reproductive technologies present with complaints of nausea, vomiting in her first trimester. First trimester patient present with nausea, vomiting. It's a common thing. She gives a past history of vomiting in her previous, okay, but she believes it was worse this time. Now the twist occurred. There is a worse nausea and vomiting. Her vitals are stable. Now patient is also stable. No more complications were noted. What's the next best step बेटा? बेटा पेशेंट के पास nausea vomiting करके आई है, लेकिन पेशेंट स्टेबल है. It will think it's a severe nausea vomiting as per patient, but patient is totally stable. Now what we will do? Get her admitted. Can we admit her because of nausea and vomiting in her first trimester? No, without knowing what is the fault, we will not go directly admit her. Can we do ultrasound? Yes, we can do. Start her intramuscular promethazine. Can we do? Yes, we can do it also. Start her IV fluids. But beta, patient is stable. Patient is not dehydrated. So IV fluids देंगे नहीं, क्यों देना है? Now between this and this, what is an answer? Either get an ultrasound or give her intramuscular promethazine. It is an antiemetic. It will give a symptomatic relief to the patient. But the question is better. It is given there is a hint of artificial reproductive technologies. In this ART, if a baby is given, their question is mentioning artificial reproductive technologies, meaning there is a risk of beta multifetal pregnancy. Because ARTs have a risk of multifetal pregnancies. And ARTs have a risk of multifetal pregnancies. And in the first trimester, nausea vomiting, severe nausea vomiting can also put out a hint of molar pregnancy. So, beta, giving just a symptomatic relief will not be the best thing. It is if it is just saying what is the next step. My next step would be this intravenous promethazine, but next best step, the best step will be beta. Always get an ultrasound done. It will rule out multifetal pregnancy or moral pregnancy. So both are actually the correct options, but the best question is the best among them. The best will be the ultrasound get, because by which ultrasound we can get some diagnostic clues. By giving only drug, it gives a symptomatic relief. So got it? If it says next step, then I will go this promethazine. The next best step, I will go ultrasound. Got it? 72 years old patient present with Drusen has developed a metamorphosis and an acute central bleeding recently. It has a Drusen's and a metamorphosis. Drusen's metamorphosis means there is something macular defect beta. And which investigation is most sensitive? Most sensitive for detecting the exudative changes, beta. Most sensitive term is written the most sensitive. Can it be a FFA? Can it be the OCT? Can endocrine green angiographic or B scan ultrasonography? Can it be? There is an defect of macula, and macular pathologies are best seen in most sensitive phase for OCTs are the best for this beta for macular pathologies. If there are something retinal, neovascular hemorrhages, then angiography, this is a vascular something, some new hemorrhages at all, leakage, then it is you will go for the FFA. OCT is will most sensitive. Oxytocin is released when the cervix is stretched by the fetal head, leading to the uterine contraction. What does control matter? But even from the first year, we know whenever this oxytocin is released, this cervix fetal head को touch करेगा. This will signal to the uterus pituitary. There occurs a signal bank to increase more and more contraction. More and more contraction will lead to expulsion of this baby. This is a better positive feedback mechanism. Everyone knows. So, beta, question number 162. 30-year-old man, it presents with persistent vaginal bleeding 3 months after evacuation of a complete molar pregnancy. Beta HCG level was itna. X-ray shows bilateral pulmonary nodule. The interval of the pregnancy is 3 months. Have a 5 lung metastasis. Largest metastatic lesion was this 2.5 centimeter. There is no evidence of liver or brain metastasis. The most appropriate FIGO classification. We are saying the FIGO classification of WHO combination of the FIGO and scoring system. Beta. The WHO score. WHO score based on this FIGO, it will be better. If it is 0 to 6, score comes 0 to 6, then it will be a low risk. If it is greater than 6, this greater or equal to 7, then it will be a higher risk. For the scoring system, how you will remember beta? How I remember is that I remember this is like this. Aam Aadmi Party is largest nokri producing. How I remember this beta? Means age, A means A means antecedent pregnancy, P means pre-treatment with pregnancy, I means interval, S means site of metastasis, L means largest, and Nokri means beta. N means no number of metastasis producing means previously this chemo producing, previously faded chemo. Take. Now the beta, let us see the score of this patient beta. The age is beta less than 40 years. The score will be the 0. And for this beta, HCG, presence of HCG is greater than 10 for 5, so score of 4 will be there. And the interval of the pregnancy is 3 months, so score will be 0. Metastasis is 5. Metastasis is number of metastasis is beta 5, so it will be a point 2 will be added. So let us see other thing is uh, total score. So site of metastasis is lung. Site of metastasis is beta again a lung. So it will be a 0 again. So total will be score 4 plus 2. It will be a 6 only. So it will be beta total score of 6. So for score 6, WHO, it will be a low risk uh, low risk score beta. So as per them, so only one which having low risk is a stage A. That means the option will be stage 3, low risk. Now, what about the staging of this? Staging is totally different beta. Stage 1. Stage 1 is beta. Disease is confined to when disease is confined only to the uterus beta. Stage 2, when there occurs a lung metastasis. Stage 3 beta, when stage 1 disease is confined to uterus beta. Stage 2 beta, it goes outside. Stage 1 is uterus. Stage 2 is beta uterus, but goes other pelvic structures. Only pelvic structures. Stage 3 is lung. Stage 4 is beta distant metastasis. So for this, the patient is having a lung metastasis, it will be a stage 3. So now let us move on to question number 163. 50 years old male presents with progressively increasing penile curvature presents OPD. But at this penile curvature, normally whenever there occurs a penile curvature, go with the Peyronie's disease. He complains of pain on exam. There is a this plaques and papules on the dorsum of the penis. This is characteristic of this is Peyronie's disease. Identify the correct statement. Now let us see what the options are. It can never occur due to trauma. Yes, it can never occur. It occurs due to micro traumas. But a character, it is a micro trauma, not through character. Trauma can cause a fracture of the spine, not this curvature. Micro hemorrhages under tunica albuginea says yes, it is correct. Circumcision is a definitive treatment. No, circumcision is not a definitive treatment, but a definitive treatment is removing these plaques and causing corrective surgeries. Removing these plaques and causing correction of this curvature. The penile plaques are premilect. No, beta, these are not premilect. These are not premilect. Only correct statement from this is a micro hemorrhages under tunica albuginea. Okay. Now, another important question, beta. The following nerve is marked in an anatomical examination. This is a nerve, beta. This is marked, and here it is given a levator pelvis superior. That means this is eye. This is an eye, and this is a levator pelvis superior, and which is a nerve, which travels superior to this. This is a beta symbol, frontal nerve. The question asks about it is branch. It is not a front. It is not only stopping at here. Now it is telling us what is branch of this. Beta, normally this is an eye. Okay. Suppose these are the two eyes, and here this is a frontal nerve. This is a beta frontal nerve of it. Now it is telling about the branches of the frontal nerve. They are clues, but this is clues confusion. The supraorbital, infraorbital, supratrochular, and infratrochular. You have to remember guys clearly. You have to guys better remember this once for all. Okay, beta. Beta supratrochular and supraorbital nerves. Infratrochular is a nasociliary nerve, beta. Right to this. Frontal nerve gives beta. Remember this and write down this. It gives supratrochular and it gives supraorbital. It gives supratrochular and supraorbital. Okay, beta. Now for infra. For infra ones, infratrochular and infraorbital. Infratrochular is given by nasociliary branch. And infraorbital is related to beta maxillary nerve. Infravenous are not related to it. So option beta for this answer will be supra and supra, supra and supra. Frontal nerve is related to supra and supra. Okay, long ciliary nerve, it is a branch of nasociliary branch. ठीक है आप चलो बेटा question 155 165 when complaints of knee pain locking sensations he notes the following the game out of football footage, he doesn't recall any acute event that respiratory this pain. The test is showing what is this test? You have to remember better the images of this thing. The test here it is showing by applying the pressure and then rotating. This is an apply grinding. This apply also known as apply grinding test or the applies test. And what are the other? What is Lessman's test? This is the better Lessman's test. What's McMurray's test? This is a better McMurray's test. Here there is an look at the only 10 to 20% this flexion is there. Now look at this, it is almost 90% flexed beta. This is a differentiated from this Lechman's and McMurray test. What is this test beta? It is totally different beta. You have to stand and then rotate around this. Try to remember these images. A young man with a presents complaint of intermittent swelling of the knees following exercise. There is no history of any mucosal bleeding. Laboratory tests are given. Factor A is reducer. Reducer factor A beta means hemophilia A. And patients having this swelling means hemorrhosis. So it is clear cut given there is a clotting factor deficiencies. Which monoclonal antibodies can be in? Oh, hemophilia monoclonal antibody which increases the factor rate is emicizumab. Emicizumab beta is a monoclonal antibody which increases the factor rate. What is trastuzumab? Trastuzumab is HER2 anti-HER2 beta. Anti-HER2 beta, and it is used in breast cancers. What is beta? Ipilimumab. Ipilimumab is a CTLA4 inhibitor, is a checkpoint inhibitor and is used in the melanoma. What is natalizumab? Natalizumab beta is an anti-alpha 4 integrin monoclonal antibody. Natalizumab is used in this multiple sclerosis beta. Only one condition which is imacizumab, याद रखना imacizumab, it is used for hemophilia A. Oh, a chronic alcoholic 67, but a chronic alcoholic patient presents with hematemesis. After the failure of all the treatment, he went to following procedure for all this portal hypertension. He went this procedure beta. Is given he went to this procedure. What is this procedure beta? This is here inferior vena cava, right left renal vein, and there is a shunt. It went for the portocaval shunt. Now this is a portal vein. There is a splenic vein and splenorenal shunt. Splenic vein is connected to this renal vein. He went to this shunt to decrease this for the risk of and identify the shunt. अब इस shunt को क्या बोलते हैं बेटा? Near. Now look at the beta shunts. I have given beta splenic and renal vein shunt. Here, this is known as distal linorenal shunt, also known as Varanus shunt. Also known as beta Varanus shunt. Here it was a splenorenal shunt, also known as shunt. Okay. Now the other shunts, Linton shunt, side to side shunt. There are two beta. This is proximal. How can you do better? There you can go for this. These are proximal, distal one, distal, and the proximal. Here the portal vein is the distal linorenal shunt, which splenectomy is done. This is known as Linton shunt, and the side to side beta, side to side shunt beta, linorenal shunt without splenectomy is known as Mitra shunt. Here you can remember these shunts. A 65-year-old woman diagnosed with gallbladder carcinoma was performed for palliative care. Review of her previous records reveals ultrasound findings of 5 mm gallbladder, poly 1.5 mm gallstone, and plain X-ray abdomen shown below. Which is the following is the risk factor? Among the given factors, which is the following risk factor for the gallbladder carcinoma? Beta, this is in GB. Calcification of GB is known as porcelain GB, and porcelain GB is a risk factor for GB cancer. Others, what are the other risk factors? Beta, other risk factors for GB carcinoma is, yes, gallstone. It should be greater than 3 centimeter, and there can be other primary sclerosing cholangitis. Polyp should be greater than 10 mm beta. ठीक है, porcelain gallbladder. ठीक है, these are the risk factors for the others. Now the question is 20-year-old began to do obstetric clinic 6 weeks of the immunity, UPT positive, the family history of thalassemia, child at first degree which are following is not true, but chorionic villus sampling beta, chorionic villus sampling normally beta हम 10 to 13 वीक यानी फर्स्ट ट्राइमेस्टर में करते हैं. इसमें कम करते हैं बेटा, इसमें हम यही फेटल दिस सैंपल लेते हैं बेटा. कोरियनिक विलस जो ट्रोपोब्लास्टिक सेल्स है, ट्रोपोब्लास्टिक सेल्स को हम स्टडी करते हैं. इसमें हम क्रोमोसोमल एबनॉर्मेलिटीज डिटेक्ट करते हैं बेटा. इनबॉर्न एरर ऑफ मेटाबॉलिज्म वो करते हैं डिटेक्ट. ठीक है, और फॉर डीएनए एनालिसिस, डीएनए एनालिसिस में हम बेटा जो भी इश्यूज होंगे, फॉर एग्जांपल हीमोग्लोबिनोपैथी, सिकल सेल एनीमिया है, थैलेसीमिया है बेटा, वो हम डिटेक्ट कर सकते हैं. कर सकते हैं बेटा. फोर्थ, दिस inborn error of metabolism, chromosomal abnormalities, or DNA problems. Whenever there are DNA issues in the DNA, hemoglobinopathy, sickle cell anemia, thalassemia, they can be detected by this chorionic villus sampling. Now, which of the following is not true for this? Can be for this chorionic villus sampling. It can give results even in first trimester. Yes, it gives in the first trimester. Suitable for detection of chromosomal. Yes. Suitable for detection of inborn error of metabolism. Yes. Suitable for detection of neural tube defect. No, it is not न्यूरल ट्यूब डिफेक्टिव. न्यूरल ट्यूब डिफेक्टिव बेटा उसके लिए हमें करना होता सीरम अल्फा फीटो प्रोटीन, सीरम अल्फा फीटो प्रोटीन, या हम यूएसजी करते हैं बेटा, या हम यूएसजी करते हैं. यूएसजी सीरम अल्फा फीटो प्रोटीन और यूएसजी. हाँ, अमाइनो सिंथेसिस we can measure alpha fetoprotein from amino synthesis that can also use us for detection of the neural tube defect. Not chorionic villus sampling. Chorionic villus में हम trophoblastic cell use करते हैं, not the serum फ्लूइड दोनों यूज करते हैं. ठीक है बेटा. A patient with surface alcoholic hepatitis, patient के पास alcoholic hepatitis है. Now alcoholic hepatitis, when we call a patient has alcoholic hepatitis, AST by ALT, the ratio should be greater than 1.5 is one criteria. Criteria number 2, AST should be greater than ALT and the value should be less than 400. दोनों increase होने चाहिए, both should be increased, but it should be less than 400. And the patient should be alcoholic. Patient should be alcoholic. Patient should be alcoholic. And if a patient should be alcoholic for more than kitna days, it should be alcoholic for more than 6 months. And if he has stopped this alcohol, then it should be present with less than 60 days of abstinence. Less than 60 days. He has taken alcohol for more than 60 days. Now, if he has stopped alcohol, then if we are doing test, the test should be done within 60 days of abstinence. Then, if this criteria applies for this alcoholic hepatitis. Now, what is least convenient? Which one of the favor the diagnosis? ALT greater than ALT, yes. Greater than, no, it should be less than 400. Total bilirubin, these are the common things. And heavy alcohol intake for more than 6 months with aspiration, yes. 2 months means 60 days, yes. This also, that means this one is not. So option A will be the correct option. 71, 26-year-old primary gada with 39 plus 4 weeks of gestation in the active phase of labor or vaginal exam. Cervix is 6 centimeter dilate. Try to remember, cervix is 6 centimeter diameter despite 4 hours adequate uterine contraction, repeated examination, cervix is still 6 centimeter. Cervix is arrested. ठीक है बेटा, cervix is arrested. No further cervical dilatation. Cervix has nothing. Membrane is ruptured. The fetal heart rate remains unchanged. What is the mesh described? What is this abnormality? When the cervix does not dilate, it means it is an arrest. So one only phase is an arrest of the active phase. Active phase beta starts from the 6 centimeter. Whenever the 6 centimeter of the cervical dilatation occurs, it is an active phase. So from 0 to 6, it will from 0 to 5 beta, 0 to 5 centimeter will be a latent phase. So from latent phase, so latent phase is gone, latent phase is gone. So active phase is started, but it is arrested. Protected means slow dilatation. Normally it should be 1 centimeter per hour. If it occurs less than that, less than, for example, in 4 hours, it is 7 centimeter now. After 4 hours, it is only 7 centimeter. Normally it should be between 8 to 9 centimeter, but it is 7 centimeters. So it is slow active phase. Then we can call a protected active phase of labor. ठीक है बेटा? A multi-center ophthalmic retrieval is a distance visual activity chart that gives a similar crowding. This gives a similar crowding across line space parameters letter by letter. Now that this is something which is a totally new for me also, and is more reproducible than the OPD chart. The better OPD means the Miscellaneous chart. Which chart should be selected, better? And will give us the only one chart which gives letter by letter. We can remember this the chart. This is only totally new for me. That chart which gives a letter by letter scoring, and each letter has an equal distance. Better, for example, distance between A and B and C is totally to equally distance. Similarly, the lower one they have equal distance from each other. Gives letter by letter scoring. For scoring this letter, it gives a score. It gives each letter. It gives a scoring of each letter. It is only the log mod chart. It's a log mod chart, and it is used for needs a distance visual acuity for distance visual acuity, and for this Jaeger chart, it is used for near vision. Near vision. Landlord C chart. It is actually the Miscellaneous chart, which is for those who are not able to read. It is used for daily beta. Miscellaneous is for daily. It is less standard, and log mod chart is standard. One more thing, beta. The 7-month-old infant is brought vomiting patients, vomiting lethargy, hypotonia. Okay, vomiting lethargy, hypotonia can be in a number of diseases with it is intercurrent illness with poor feeding. Okay, and reveal it is an hypoketotic hypoglycemia. There means hypo ketones, hypoketones means ketones are not formed. There is a problem in ketone formation. Hepatomegaly and increase in urinary 3-hydroxy-methyl acid, deficiency of which enzyme explains this presentation. Okay, the patient has a deficiency in ketone. That means there is a defect in ketone pathway. Now let us remember the ketones. There is a ketogenesis, the formation of ketone. Acetyl coenzymes, they form H2-acetyl coenzyme. HMG coenzyme synthesis gives HMG coenzyme A, and their HMG coenzyme A gives the ketones H2-acetate and beta hydroxy beta beta. These are the ketones, our ketones, acetone and beta hydroxybutyrate acetone. These are our ketones. Now there is a defect in the formation of these our ketones, acetoate and beta hydroxybutyrate. There is a defect. Which enzyme will be deficient? Either it will be coenzyme A or it will be coenzyme A synthesis. Now our option will be either coenzyme A synthesis or coenzyme A lyase. HMG coenzyme A reductase, it is for this cholesterol. So instead, this option is gone, and succinylcylic acid co-transfer. This is totally different. Now we have a problem in synthesis of this ketogenesis. So two enzymes which are involved in this HMG coenzyme synthesis, HMG coenzyme. Now how will you differentiate? The another hint which is given is that urinary 3-hydroxy-methyl acid is increased. How it is increased? Beta coenzyme A. This coenzyme A, it is whenever there occurs a deficient this accumulation of the HMG coenzyme A, HMG coenzyme A, whenever it accumulates, it is beta converted into urinary 3-hydroxy methyl glutaric acid. It is 3 hydroxy methyl glutaric acid. Okay, beta. HMG coenzyme A is converted into hydroxy methyl glutaric acid, 3 hydroxy methyl glutaric acid. Oh, beta. So that is why HMG coenzyme A is a deficient here. If it is not given, this option is not given, the best among them answer will be HMG coenzyme A synthesis. ठीक है बेटा. HMG coenzyme A synthesis, the rate limiting syndrome. So best answer will be that. But here the given is option, either there will be both options will be correct, but hint given there is that there are urinary 3-hydroxymethyl glutaric acid is increased and HMG coenzyme is the one which gets converted into these. That is my answer is this, not this, because if HMG coenzyme A synthesis is deficient, then HMG coenzyme A will not be formed, which HMG coenzyme A is not formed, 3-hydroxymethyl glutaric acid will also not be formed. So, which are the following drug is the most likely to produce the effect shown in below? What is the drug? Beta, this is a normal, and the drug causes this glucose reabsorption, and the drug it decreases the glucose reabsorption and maintains then constant plasma glucose level. It decreases the reabsorption of the glucose, and the reabsorption of glucose occurs beta to produce the effect plasma glucose level, glucose reabsorption. If we see the beta reabsorption, I also seen SGLT2 inhibitors. SGLT2 inhibitors are present in the PCT because, sorry, SGLT2 are the beta transporters from the PCT. They cause the reabsorption of glucose. When these receptors, these transporters are inhibited, they cause decreased reabsorption. They cause decreased reabsorption. Decreased reabsorption causes decreased blood glucose level. And these are the drugs which can be used as these are the this dapagliflozins. These are the drugs, gliflozin is better. These are the drugs which act by decreasing the glucose renal reabsorption. And what about this glitazones? Beta D glitazones act mainly act on PPAR gamma. These are PPAR gamma agonists, and it promotes beta insulin activity. These promotes insulin activity. What about the metformin beta? Metformin decrease the beta hepatic gluconeogenesis beta. ठीक है बेटा. And what about the glimepiride? Glimepiride beta, it acts as stimulating the pancreatic beta cells and they release the insulin. Only one drug from them is glitazone. Sorry, this dapagliflozin. They act by this reabsorption. Which are the following the incorrect statement of this organization? Now, first we have to find what this organization is. This organization बेटा एक बच्चा है, इसके साथ एक माँ है. This is बेटा UNICEF. ठीक है. यूनाइटेड नेशंस इंटरनेशनल चिल्ड्रंस इमरजेंसी फंड. But you have to remember some this formula, that full name of this formula as well. The United Nations International Children's Emergency Fund. But you have to find that. Now, its headquarters is located in New York. It is headquartered in located in New York. Yes, it is correct. It promotes Gobi. Yes, it promotes the Gobi, campaign growth. Gobi, you have to remember G for growth, O for oral rehydration formation, B for breastfeeding, I for immunization. Yes, because it is related to this what's known as the infants and mother. And other options, what are the other options? Better. Other option is says it particulates in the UBS project to improve health, nutrition, water supply, sanitation. This maybe, and some months every WHO is focusing on water supply, sanitation, nutrition, and also it may be answer. It focuses on malaria eradication, tuberculosis control. No, better. It is not the core project of it. It is not a core project of this better. It is not a core project of this. ठीक है बेटा. यूनिसेफ का ये प्रोजेक्ट नहीं है बेटा. ये WHO का अलग प्रोजेक्ट है, तो यूनिसेफ का भी ये प्रोजेक्ट नहीं है बेटा. One more, and it is a very tough question. It's not an easy question to handle better. Patient presents a recurrent epistaxis and progress to nasal obstruction. Imaging shows a vascular nasopharyngeal mass extending into the pterygopalatine fossa. NEET will ask only this much of question. What is an answer? It must be a this what's known as juvenile nasopharyngeal angioma. This is an answer. NEET will ask this question. Now, Marrow is always testing your the depth of the knowledge. He also has a numbness over cheeks. Now, juvenile nasopharyngeal angiofibroma, it is seen at what it is seen a vascular enlargement pterygopalatine fossa. Has a numbness. Patient has a numbness on upper lips. It has an upper teeth through which opening intracranial extension most likely occur. Now it is telling us that through which intracranial extension occurs. Now we should know if a patient is having, okay, beta. Suppose these are the eyes of the patient, this is the nose of the patient, and this patient is having uh, numbness over the cheeks, and this patient have a teeth. These are the upper ones, and these are the lower ones. This patient had a numbness in this area, cheeks में numbness है, it having upper lip में, and it having the teeth. This patient having numbness in this area. Actually, it is saying that the nerve which is damaged. This nerve which is damaged, better it is a maxillary. These are the maxillary. This is a maxillary nerve. So maxillary nerve with damage, and which foramina passes the in which of the foramina passes this maxillary nerve? The maxillary nerve better passes among them is foramen rotundum. Foramen rotundum better. Maxillary division of this cranial nerve tree. But maxillary say if you know better foramen oval, there is a male M-A-L-E, this male, it is a mandibular nerve. Mandibular nerve. Okay, better not maxillary. The maxillary passes foramen rotundum. So this is how I think this can answer this question. Just by knowing the clinical features, not by exactly where this term has come and where this nerve has gone. So this is a difficult question to remember at this level in 8 PG level, I know. So beta, this is an narrowing. Everyone should know it. I think it is in crop. This is in crop. So beta, steeple sign. And this crop is caused by beta caused by parainfluenza virus. Which of the following organ is likely cause this is in beta parainfluenza virus beta. Moraxilla causes beta acute otitis media beta. Hemoinfluenza causes epiglottitis. याद रखना बेटा ये दो condition parainfluenza and hemophilus influenza. Parainfluenza causes crop and hemophilus causes epiglottitis. 28-year-old male present with abdominal cramps, tenseness, passage of small amount of stools mixed with blood and mucus. That means it has a diarrhea, complicated diarrhea, it has a blood mucus. Stool examination is performed to I know. Now it is saying that stool examination means a parasite is something. We have to find the examination from the stools. Patients has a diarrhea, it has an hemorrhage, and it has something dysentery at all, small stones with blood, mucus. Now the patient, it is giving us hint that you have to diagnose from the stool. By diagnosing from the stool means we are looking at the parasites. Which are the following findings mostly strongly suggestive of the innovation? Now it is giving an invasive amoebasis. Now amoebasis versus invasive amoebasis. बेटा amoebasis हम कैसे diagnose कर amoebasis is caused by बेटा anti-amoeba histolytica. And if you know better, anti-amoeba histolytica, cysts with 4 nuclei, beta, cysts with 4 nuclei, this can be a diagnostic for, but it is normally for non-invasive, beta, for non-invasive amoebasis. ठीक है बेटा, non-invasive. Acid fast oocytes, can it be diagnosed? Acid fast oocytes are beta, it is usually for coccidian parasites. any cryptosporidiums at all, and they have a watery diarrhea. Pear-shaped flagellated trophocytes, these are diagnostic for GIDs. Now, this trophocytes containing the RBCs, known as beta, this is known as erythrophagocytosis. This is a characteristic pathognomic for anti-amoeba histolytica. One thing that you remember from this, that erythrophagocytosis, erythrophagocytosis, erythrophagocytosis beta is characteristic of anti-amoeba histolytica. Then characteristic of anything, and it is seen in invasive lesions. So that is why this will be answer, not this one. Okay, these are because it's not a diagnostic of the invasives. Moving on to this 179. 20-year-old infant was brought to the emergency symptom with sign of rapid breathing failure. The X-rays of the unit, probable diagnosis. Always look at the image whenever there occurs an image. This image is better. When you see this image here, it looks like that a snowman. The snowman origin figure of 8 appearance. It is seen in total anomalous pulmonary venous circulation. Now, how you will remember, beta? I have given you a table, beta. This box-shaped heart, Ibsen anomaly. ठीक है बेटा. Palate always foot F for palate, F for foot means it's an. There may be a boot-shaped heart. फुट को बूट बोलते हैं बेटा. इट इज फूड शेप्ड हार्ट, याद रखना. बूट शेप्ड हार्ट. एबिस्टेन एनामली, बॉक्स शेप्ड हार्ट. egg means beta. There is an egg on string per separate. It may be transposition of the great arteries. Here great. G means great. Egg. It means transposition of the great arteries. G यहाँ पे भी आता है, G यहाँ पे भी आता है. G. This is how I remember these things. ठीक है बेटा. यहाँ पर भी आप फुट देखोगे बेटा. टेट्रोलॉजी ऑफ फैलेट, बूट शेप्ड हार्ट होगा बेटा. फुट मींस बूट होगा. यहाँ पे आप बेटा एग अनस्ट्रिंग अपीयरेंस देखोगे. एग मींस ट्रांसपोर्टेशन ऑफ ग्रेट आर्टरी. यहाँ पे भी जी है, यहाँ पे भी जी है. दिस इज अ ट्रिक you would remember, and it is highly useful. A diabetic patient, question number 180. Diabetic patient comes to you requesting a suitable carbohydrate diet for he common. A diabetic patient have which carbohydrate he or she should consume beta. For diabetes patient, we should give them a complex foods. Why complex foods? So that it takes longer time to digest. And when longer time they are slowly blood glucose will not spike. We maintain a constant small, and we try to maintain a blood sugar level. It should not go high, it should not go down. That is why we give them a complex, so that they will it takes some more time for them digestion, so that they will not eat more. Their stomach should feel just full, and it should continuously digest small, and their sugar level should be maintained. So which among them is the most complex? Monosaccharides? No. Oligo, disaccharides? No. Which among them is most? As clearly polysaccharide. These are the most complex among them. That is why polysaccharides will be the answer. Question number 181. A 52-year-old woman presents with hot flashes, night sweats, sleep disturbance for 8 months. She attained at menopause 2 years ago and was on now wants HRT. A woman, जिसको हम बेटा, whenever a woman wants hormone replacement therapy, we should always look for this uterus. Because if uterus is present, then you have to give estrogen plus progesterone. If uterus is absent, then you will go for estrogen alone. Okay, बेटा, because estrogen causes endometrial cancer. That is why we don't want patient to use estrogen alone. In this patient, the uterus shows intact uterus. So we will go with this estrogen plus progesterone. That is why this option number D will be the answer. 182 beta. The patient has a snack button and the snack is given. How to identify this snack beta? If a snack having these two white lines over this body, it is known as a crate. It's beta, usually the crate. The crate is beta. It is an neurotoxic. It is a neurotoxic, hemelotoxic, or vasculotoxic, or vipers. What are the musculotoxic? Are the C snacks, but are the musculotoxic. 20-year-old male patient complains of sudden decrease in vision in both eyes, pain while, but it has a pain while moving his eyeballs. On examination, he found it difficult to read. Fundus examination, there is a normal discus better. This का कोई issue नहीं है, and vessels are normal. Try to remember these points which I highlighted. Pain, whenever a pain with moving eyes means there is something inflammation. Inflammatory condition is there, but the district is normal and vessel is normal. Now, what about the Ehlers disease? Ehlers disease is a condition which causes a recurrent hemorrhage. Vitreous hemorrhage. There is a recurrent vitreous hemorrhage, but a hemorrhage occurs when vessel is abnormal. Here the vessel is normal, so this cannot be the answer. Papilledema, there is a disc edema, but whenever there is a disc edema, no, disc is normal, so this is again a problem. Retrobarbar neuritis is an inflammatory condition. It causes pain. Yes, this can be answered. Peptides, it's also an inflammatory condition. It can cause pain, but it will also affect the disc. Here the disc is normal, so this cannot be answered. So option C, retrobarbar neuritis, will be the answer. ठीक है बेटा. Now, question number 184. A patient complains about dizziness on standing from a seated position. It complains some disease. Patient was seated. Now, when it stands, it complains some dizziness. Okay. And when we find a BP here, this BP was 130 by 88. On standing, BP goes 100 by 70. Now, what is the change in BP beta? Systolic blood pressure change occurs 130 minus 100, it is 30. Similarly, diastolic blood pressure change is 18. So, this is a case of orthostatic hypotension. What does this orthostatic hypotension mean? Orthostatic hypotension means whenever systolic blood pressure decreases by 20 and diastolic blood pressure decreases by 10 on changing position from supine to standing. This is known as ortho, and the criteria is stated here. What is the problem, beta? Normally, when a patient goes from supine to standing, normally, beta, blood pressure will drop. But how this is compensated? This is compensated by stimulating the baroreceptors, and they will increase the sympathetic activity. This causes vasoconstriction. They try to increase the BP and maintain the blood pressure. So if problem is baroreceptors, whenever the there is a problem, this compensatory mechanism does not occur. So beta, there occurs a decreased baroreceptor. The question is, what is the physiology behind this? Because orthostatic hypotension, the physiology should be the baroresponse. Baroreceptor response is not there. ठीक है बेटा, baroreceptor response is not there. What are the other options which we don't? Vasovagal syncope, decrease the vasovagal. This is better in response of the emotion at all when the patient goes an emotion during examination. Sometimes such a bad news and they go in a syncope. Uh, this is related to that better. Bizol, just BZ. Better try to remember BJ reflex. BJ reflex. There are set triad. Bradycardia, hypotension, and apnea. This is an triad. Brain bridge. What about the brain bridge reflexes? But a brain bridge reflexes means increase in heart rate by increase in preload. Preload, whenever the preload occurs, it increases the heart. This is known as brain bridge reflex. It's try to differentiate between the BJ Bisolger's reflex, there is a triad, and Bain bridge reflex. There is a preload and heart rate. Oh, 185. Question number 185. A 32-year-old male presents with 3-week history of subacute fever, worsening headache, and neck stiffness. Fever, headache, neck stiffness is something infective condition. CT of the brain is showing. CSF shows. CSF analysis. CSF shows proteins increased, glucose decreased, and lymphocytes are increased. And this is a characteristic of lymphocytes with CSF protein increased tuberculosis. Initial management of this condition to reduce the what is the initial condition to reduce the mortality? बेटा कौन सी condition है to reduce the mortality? We know this is a tuberculosis. Now we know because proteins are increased, lymphocytes are increased, and next stiffness is a meningitis, tuberculosis meningitis in this patient. Here there occurs in hydrocephalus. Ventriculus are increased, there occurs in hydrocephalus in this patients. What we will start to increase them, we use a HR, bloody drug. These are the standard 4 drugs. We use a standard 4 drug. We use a standard 4 drug. Immediate ventricular period. No, this is a non-communicating hydrocephalus. Can we give ceftriaxone and vancomycin? Because of tuberculosis, we use anti-tuberculosis drug. We will with dexamethasone. It decreases the inflammation. We want to do the inflammation. What is done? What we have to done with the aspirin? Nothing. We have to do nothing with the aspirin. We want to do the inflammation because it is a meningitis inflammation condition. That is why dexamethasone corticosteroids are given. So we will use that, not the other conditions. While inspecting a crime scene of the murder scene, whiskey glasses were found on the table. We found a whiskey glass. We found a whiskey glass. In the whiskey glass, there must be a fingerprint. So the latent fingerprints, these are the fingerprints which were not visualized. That is why it is on later. We have to form, we have to exaggerate them, we have to extract fingerprints from the glass. Which are the conditions which can be used? Can be used. The latent prints from the glass can be utilized by how we will use it. These are the methods to enhance the lightening method, physical method, and the chemical method. From the lightening method, we use ultraviolet spectrum lightening. Ultraviolet lightening. That means this is a correct method. Physical. From the physical method, we will give them a fine powder of contrast. Here there is not option in the chemical. Cyanoacrylate fuming. Here in the powder method, here black carbon based black powder used. Now the Pearson method is not used. What is Pearson method used for? The estimation of beta. It is used for estimation of the stature, not fingerprints. These are the methods to enhance the fingerprint. This is a factual theoretical question. Either you know or you don't know. There is nothing concept behind this. Oh, most important question, beta. Question number 187. Question number 150. A patient is having a severe dehydration. Severe dehydration. What does the treatment protocol say? Treatment protocol says we have to give IV 100 ml per kg. IV 100 ml per kg. As per the age. If age is less than 1 year, or if age is greater than 1 year. If it is less than 1 year, then we give total fluid will be given in 6 hours. But if age is greater than 1 year, total fluid will be given in 3 hours. How to give? First 30 ml we will give in 1 hour. In this condition, it will be given in 30 minutes, and the next 70 ml will be given 70 ml per kg will be given in 5 hours. It will be given in 2.5 hours. So this is a normal route, normal IV. Now the question is that multiple attempts at intravenous access fails. Patient has severe dehydration. Normal treatment was normally it was IV fluid. It was an IV fluid RL 5% dextrose. This was a normal IV intravenous. But now the question says we are not able to access the IV line. Now we have to give it orally by nasogastric tube. We will give it by nasogastric tube. ORS to be administered. It will be given by a nasogastric tube. It cannot normally, it cannot take orally because it is a severe dehydration. So we will give him a nasogastric tube. The rate at which we are giving, no matter what is an age of the patient, it is 20 ml per kg per hour hour, it will be at 20 ml per kg per hour at a rate of 20 mg per kg per hour for 6 hours. ठीक है, 20 ml per kg per hour. ठीक है बेटा, it is not over 6 hours only. It is, there is a difference of 20 kg, 20 ml per kg and per hour or 6 hours. Not this 20 ml per kg over 6 hours. You have to mention per hour. Question number beta 188. 188 patients present with choreiform momentous personality changes and cognitive MRI of the brain, which are the following bedside sign. It's a bedside sign would be mostly supported again. Here if we see there occurs in this the lateral anterior horizontal, it looks a box score. Appearance, it is Huntington's disease. It's a characteristic of this beta Huntington's disease, and Huntington's disease beta bedside test is beta is beta inability to sustain voluntary contraction, motor impersistence is the bedside test for this Huntington's chorea. What are the others beta? The tremor beta, wing beating tremor is characteristic of, it is Wilson's disease. It is seen in Wilson. Pill rolling tremor, wing beating tremor is seen in Wilson. Pill rolling tremor is seen in Parkinson's. And what is dysarthria, scanning dysarthria with intention tremor. Scanning is seen in multiple sclerosis. This is how you can rule out if you don't know about this thing. No one knows about this thing. This is how can you can rule out wing beating tremors. This is normally seen in Wilson. The resting ill pill roll tremoring is seen in this Parkinson's disease, and scanning dysarthria with intention tremor is seen in the Wilson disease. Which are the foreign hormonal contraceptives seen in Norplant 2? It is seen in levonorgestrel. But this is a table pull from the marrow you can use with you can for remembering. Norplant 1 causes levonorgestrel 35 mg. Norplant 2 it also contains levonorgestrel 70 mg. It contains beta levonorgestrel. 25-year-old peasant with enteric fever with rising titers against Salmonella O and H antigen. Which are the following statement? But just try to remember Salmonella O antigen H. H means flagella means mortality. ठीक है बेटा, O is somatic antigen. Titers against O means it's an acute infection, and this is used for the diagnosis. H antigen beta, it can be seen response to the H antigen, it can be seen in later phases or convalescent phases also. It can be seen the patient is resolving or in later or in chronic phase. But actually, better the infectious stage, the recent infection stage, it will be the titer against these anti-O antigens. O antigen is pleasure. No, O antigen is it's a somatic antigen. It is a heat liable. No, beta. O antigen is not heat liable. This O antigen is heat stable antigen. O is somatic and it is stable. याद रखना. S it is O means somatic and it is stable. H means it's a heat liable antigen. What will be the answer? O antigen is somatic, yes, and more indicative of the acute infection. This is the correct to remember. Presented 35-year-old woman presented with postural dizziness and fatigue. On examination, her skin shows hyperpigmentation. Okay, patient has a postural problem. Her lips, palmar creases, knuckles, and parameter has hyperpigment. On examining her pulses and blood, patient has hypotension. BP is itna with hyperpigmentation. Hypotension with hyperpigmentation with fatigue, which are abnormalities least likely, which abnormality is not seen in this condition, but hypotension with uh, hyperpigmentation. Normally, this is known as the Addison's beta adrenal insufficiency. It is similar to the mineral this uh, adrenocorticoid excess बेटा, जहाँ पे हम उसमें क्या करते हैं बेटा, उसमें हाइपरटेंशन होता है बेटा, हाइपरटेंशन हियर देते हैं हाइपोटेंशन, यंग में मेल यहाँ पे भी आपको हाइपोटेंशन प्राइमरी हाइपोटेंशन दिखेगा, तो थिंक अबाउट दिस के प्राइमरी एड्रेनल insufficiency. Now adrenal glands are not signaling properly. Adrenal gland is not signal. This adrenal gland is not beta functioning properly. When adrenaline is not functioning properly, what is the function of adrenaline? Adrenaline, it causes sodium reabsorption, and potassium causes, it causes beta potassium secretion, because adrenaline is not functioning properly. When adrenaline is not functioning, it sends a signal to the pituitary, please send adrenal stimulating hormone, mm, and that will also cause the stimulation of this um, ACTH. This ACTH will also stimulate other melanin and other hormone. That's why this patient has a pigmentation. So what will be the aldosterone? Aldosterone normally causes increased sodium absorption and potassium secretion. Now, aldosterone is not there. What will be there? Decreased sodium absorption will be there, and potassium, decreased potassium secretion. When potassium is not secreted, what will cause? It increases inside body. It increases inside body. It causes hyperkalemia. It causes hyperkalemia. So whenever the patient, try to remember this better, patient with hypotension with pigmentation, think about adrenal insufficiency. This is the criteria to think about this. So in this case, there occurs not hypokalemia, hyperkalemia should occur. Raised TSH, just it causes raised TSH because adrenal insufficiency signals them pituitary gland, please send the hormone ACTH. It sends a signal to the pituitary, please send the impulse because adrenaline is not there. Adrenaline, I need hormone, blood is telling them I need hormone, I need it, it activates the pituitary, that stimulates the other. There will be a hyponatremia, yes, because adrenaline is not functioning properly, and cortisol is also because adrenaline insufficiency is there, adrenaline insufficiency there, because adrenaline also secreted the adrenal also secreted the cortisol. The cortisol causes the hyperglycemia, so there will be hypoglycemia, but there will be hyperkalemia. By static analysis, the fasting blood glucose level in 4 different studies, each containing 100 pages. The mean blood glucose level is 100. Mean is 100. Which are the most accurate regarding the study? Which is accurate? Little bit of mean इनका 100 है. Mean is 100. All values are exactly same. Which are the following accurate regarding the standard deviations of the patient? All our values are the same. A group में सबका same है. If A has the same A all have 100 value. When all have 100 value, the mean is 100. So standard deviation will be 0. This is one thing. Values are symmetrically distributed between 90 and 100. The values are distributed between here 90 to 110. The values are distributed in between them. The difference between the values is around 20. Here the difference between the values. In option this is B. In option C, values are symmetrically distributed between 130 to 70. Here the difference is 60. Between the values difference is 60. Different values is 60. Now 95 observations are 100 and 5 observations are 200. Now the difference is 200 minus 100, that is 100. Here the difference between the values, difference between the variables, difference between the observations is 100. Now let us see. Here everyone has exactly same value, so difference the standard deviation between them is 0. But let us see. Group A has highest standard deviation because all values differ from the population, but have highest. No, it has a 0 standard deviation because standard deviation will be 0. Group B and C has the same standard deviation. Group B and C have a same standard deviation. How it can be a same deviation? Because here the value difference is by difference is 20. Here the difference is 60. No, they have no same this what's known as the standard deviation. Standard deviation is totally different from them. Group D has a longer standard deviation than Group C. Group C, yeah, the difference between them is 100. The difference between them is better. The difference between them is 100. Larger the difference, larger will be the standard deviation. How I came to this answer, better. If all have same values, then I will value minus mean, I will get standard deviation. If all have different values, then I will check the difference between इंटरनल वैल्यूज जो एक ही बॉक्स में वैल्यू उनके अंदर कितनी डिफरेंस आ रही है. जितनी ज्यादा डिफरेंस होगी, द लार्जर द डिफरेंस, लार्जर विल बी द स्टैंडर्ड डिविएशन. I have nothing to do with the mean at all. So this is how I came to the answer. Group A have same, so I will compare with the mean. So all will be same, there will be no standard deviation. So similarly, the group D has a longer standard deviation. Group D, the enter in the box, the value is 100. Their difference inside the value is 100. In C, the difference inside the value is 60. So they have a larger variation, internal variation. So larger the variation is, larger will be the standard deviation. Here there are 60 people have there are 60 value variation of 60. So there will be a standard deviation of around 60%. So there will be a standard deviation around 100%. So that is why group C has a larger standard deviation than group D has a larger standard deviation than group D. So now the patient presents with an early backward fall with an axial rigidity and a vertical supranuclear gaze, vertical gaze problem. Whenever a vertical gaze problem occurs in question, especially downward gaze, think about PSP. Think about PSP beta. Beyond MRI is also given here in MRI. There is a this, but this is a hummingbird sign. This is seen in PSP. This is seen in beta PSP. This is given in PSP beta. This is a condition progressive supranuclear palsy. This is seen in progressive supranuclear palsy. And in progressive supranuclear palsy beta, you think there is a characteristic that makes an diagnosis in PSP. What you can think better? एक तो hummingbird is one thing. Supranuclear palsy, there is a vertical gaze palsy. What you will remember from PSP for examination? One is hummingbird sign. Another is point number 2, downward gaze palsy is 2. Point number 3, there is a preserved. That's the most important. Preserved oculocephalic reflex. 4 is they have poor response to levodopa. 4, there is a downward gaze palsy, and this convergence retraction nystagmus is not seen. Convergent retraction is seen with the Perinaud syndrome. It is seen in the Perinaud syndrome. Okay, better. Again, they will not go in deep. They will just ask if this hummingbird sign is seen in PSP, and that's it. NEET will ask, just remember the hummingbird sign, PSP causes downward gaze palsy. These are the pointers you have to remember. At 30-year-old P3LC lady complained of bright red bleeding per vagina 15 days after. After 15 days delivery, it is secondary P. This is second. This thing of the PPH. This is thing of the PPH. This will be a PPH. Delivery of a third one. Which of the following options could likely cause this bleeding? देखो बेटा, if occurs within 24 hours, then it will be a primary PPH. If not, then it will be a secondary PPH. It will be a secondary postpartum hemorrhage. Bleeding after this delivery is postpartum hemorrhage. So beta, it will be either primary or secondary. Within 24 hours, it will be a primary or after. There are causes of this secondary and primary. Primary, mostly commonly the uterus, atonic uterus. The uterus is not contracting, it will cause primary. This perineal laceration. During this delivery, the lacerations occur that can cause bleeding. So multiparity. When a patient is multiparity patient, the uterus is also not contracting, that will lead to primary. These upper three, they will cause a PPH, primary PPH. But the polypus, they will retain and they will cause a bleeding. Placental polypus, they will cause a retained placenta. They will cause retained product subconsumption. They will cause later secondary PPH. That is why secondary PPH will be the answer to this patient. Question number 195. For 195. Question number 195. Patient come to the OPD for evaluation and complete CBC is done of this patient. The findings are shown. She is taking iron. She is taking iron from 2 years. Now she is taking iron. What is the condition? Here RBC count is this. Hemoglobin is this. Here hemocrit is less. He is having microcytic hyperchromic anemia. She is having anemia. This patient is having microcytic anemia. Because this patient is MCV is less, when this hemoglobin, he is having microcytic anemia. Now the patient has microcytic anemia. Microcytic anemia. And she is taking iron from last 2 years. But this anemia is not corrected. Not correct. That means the problem we have to find. Here, the value of iron is better normal. That means if she is taking iron and anemia is not corrected, but the iron level now is normal. So this is not iron deficiency anemia, it is something else. So what will be the next most appropriate step? First, we will stop her iron because iron will cause its toxicity. Stop oral iron and prescriptive iron. No, because we have to stop iron at all because this is not iron deficiency anemia. If you are giving iron, iron will cause toxicity. Continue the present oral. No. Bone marrow iron storage examination. Stop iron therapy and test for ferritin and hemoglobin electrophoresis. Yes, we will go like this. Why we will go iron storage? Because this patient does not have iron deficiency anemia. This will be the answer. Bo, if we go for the Metzger's index, what does this Metzger's index say? MCV divided by RBC count. Here, if we go, MCV is 64, RBC is 6.1 into 10 raised power 6. If we calculate this, it comes around 10 to 11. It comes around 10 to 11. So if index is better, less than 13, here, if index is Metzger's index less than 13, then it is a diagnostic of thalassemia anemia. It is a diagnostic of thalassemia. A differential is thalassemia with iron deficiency anemia. So this patient have a thalassemia. That is why we will go for the hemoglobin electrophoresis techniques. So we will try to diagnose that. 196. A patient presents with progressive increasing pain and swelling over the mid shaft of the tibia. If patients having pain, swelling of the 3 months of the fever pain, think about the osteomyelitis. If not osteomyelitis, then there will be a close difference to the evingus. In young patients, it will present like osteomyelitis. In young patients, that is evingus sarcoma. Intermittent fever, weight loss, and radiographic TVG, which are the following genetic abnormality is most likely to be associated with this tumor. Now it is talking about tumor. Whenever a young patient comes with like this osteomyelitis-like feature, think about this emingus tumor. Think about the emingus tumor. In the beta emingus tumor, what what will be there is AS or FL1 fusion gene defect. This is a better problem in the sarcoma. It is associated with EWSR1 FL1 fusion gene. RB1 mutation is seen in the beta retinoblastoma. 1517 PML Rama AMLM3 and USP it is seen in aneurysmal bony cyst. This is seen in aneurysmal bony cyst. Now, which are the joint marked in the image is saddle joint. Now, how you will remember saddle joint? Saddle joint is towards SMC, Srinagar Medical College. However, tumors means thumb. Towards means better thumb. How I remember them? Towards means thumb. You remember towards Srinagar Medical College. ठीक है बेटा towards medical college. So Srinagar means sternoclavicular. M means malus and incus joint. C means calcaneocuboid joint. These are the joints which show the saddle joints, which are the examples of joints. The thumb will be the first. Thumb joint is actually the first carpometacarpal joint. Thumb is actually the first carpometacarpal joint. So first metacarpal. So thumb, it is first carpometacarpal joint. This is the thumb. And it is a saddle joint. I hope this will explain. Take a better. Research that comes with glycemic response of food by food tests contain equal amount of carbohydrate. The graph demonstrated postprandial our glucose 3 hours. Regarding the glycemic, which of the following is correctly measured. Now this patient, type 1 beta, this patient has eaten, has a rapid shooting and then it goes a rapid downward. Whenever this food is eaten and this goes directly to blood and then it comes suddenly back, there's a rapid uprise and rapid down. Point number 2, there it occurs a slow uprise and then it maintains this. In this graph 3, it also shows better the blood glucose slowly rise and then it remains above the baseline. And for this 4 in graph 4, it shows that the blood glucose does not increase despite eating this food. The graph 1 was showing, I'm again showing this better. Graph 1 was showing that, let me show this better this question again. Here the better graph 1 was showing. Graph 1 was showing that whenever he eats food, the blood glucose shoots up and it gets downward. Graph 2 is showing whenever a person eats the food, the glucose generally goes slowly up, then it goes gradually down. Graph 3 shows the blood glucose, but it moves very slowly, and it tries to maintain in normal range, but just above the normal range. It tries to maintain in a normal range, but and the graph shows that the blood glucose does not increase at all after eating the food. Now, what does this mean? The graph 1, which among the following food is whenever we eat, it generally shoots up. It generally shoots up better. Among the foods, does it be a glucose drink? That will be a milk? That will be a wheat rice? Or it will be a flaxseed? Oh, of course, whenever whenever we go directly and drink the glucose, of course, we are directly eating the glucose, we are directly drinking the glucose, our glucose will shoot. So, it will be, A will be, graph 1 will be the glucose. Now, graph 2 will be better. Demonstrate a moderate but sustained blood glucose. It was a moderate level of glucose is getting high. So these patients have a medium glycemic index. Medium glycemic, for example, it will be the this white rice. The rice which we are eating have a moderate glycemic index. So it will be graph number this curve 2 it will demonstrate the curve number it will demonstrate this white rice curve 2 or yeast bread or rice the 3 it will be the curve number 3 delayed but blunted glucose evaluation. Ice cream is despite containing have relatively low glycemic index. Ice creams usually have low glycemic index because they contain mostly fat. Ice cream they have a low glycemic index. Like 4, the fruit. These are the fruits which after even which these are the things which we eat even we eat and the glucose does not change. For example, flax seeds. These are complex to digest. These are difficult to digest because they contain high fibers and fats. They don't contain any glucose at all. That is what it will show a flax seeds. Ice cream is they contain a later this blood glucose. The ice cream is actually that take a point from this is that uh, rice, bread. These are the moderate glycemic index. Ice cream is better low glycemic index food. Question number 199. A patient was brought complaining of thumb suckling for 2 months, 7 years old. He has a thumb suckling. He has a 3-month-old brother who was born preterm is Nico. He parents spend a lot of time with him in the hospital. Which are the foreign dependent mechanism his action? Now the patient is having already a thumb suckling. This was a normal phenomena up to 5 years. Up to 5 years. It was normal phenomena up to 5 years. Now he is 7 years old. This phenomena is back. That means this is an immature phenomena. This is back. This is a regression. Regression means dubara. Old habit has been has come back. This is known as a regression. What is a repression? Repression. What does it mean? The repression. Repression means beta unconscious. Beta thoughts are रहे थे इसको, but he forgets them. He forgets. Repression means he forgets. He forgets things that, for example, he has dog, so he forgets he has a dog. Reaction formation. Reaction formation is something better. If a person hates someone, but he pretends that he loves her. This is a reaction formation, beta. He pretends that he loves her. And acting out. Acting out means similarly, if a person hates anyone and he directly shows anger towards that, it's reacting form. Which another form is that regression will be the form, beta, in which old this behavior will be this they will come back. Beta. That you suspect a genital infection and hysterosalpingography of this patient was you plan to do endometrial biopsy of this patient to confirm. Endometrial biopsy was done in this patient. It says in which way this cycle the endometrial biopsy is done. Here the hysterosalpingography of the patient is done. It shows a tobacco pouch, beta. It shows a tobacco pouch. It is seen in the genital TB. Here this patient has a tuberculosis. And when we are going to do this endometrial biopsy, but endometrial biopsy is usually done 1 to 2 days before the next cycle, and day 26 of cycle is done. It is usually done on the day 26 of the cycle because because वगैरह endometrial is done 26 because बेटा normally जो tubercular bacteria है they are usually situated on the deep layers of the endometrium. This is endometrium. These are the deep layers. These are the deep layers. So before starting the next center, they come to the superficial because endometrial is thinning. Whenever the endometrial thin, because endometrial shedding will occur, the next cycle will because this endometrium becomes thin, so they come to the surface. Toward the end of the cycle, they come to the surface, and when they come to the surface, we can take the biopsy. We can take the biopsy, and during the menstruation, we cannot take because they have been shedded. So that is why, beta, day 26 of the cycle, we take endometrial biopsy so that we can get a sample of tuberculosis bacilli. Normally, they remain in the deeper layer. And I will repeat question number 200. Question number 200 will be repeated. Question number 200, the final question. You suspect a genital infection in a patient complaining of infertility, and his HSG was done. It shows beta. HSG was shown. It shows this feature. This is the tobacco pouch. It is seen in beta genital TB. Now we were saying that when you are going to do the endometrial biopsy, beta, this is an endometrium beta. Suppose these are the deep layers. This endometrial bacilli, they remain in deep layers. They are present in the deep layers. ठीक है बेटा, as tuberculosis bacilli ये बेटा present होते हैं deep layers of the endometrium. What they come beta before the menstruation. Before menstruation, beta, these endometrium, they come to lie on the surface of this endometrium. When they come to lie to the surface, we can take the biopsy just before the menstruation, just before beginning of the cycle, before the beginning of the new cycle. For example, it is a 28-day cycle. Just before it days, it might be 1 or 2 days. That means 26 or 27 days. The option is 26 days of the cycle. We can take the endometrial biopsy to detect these endometrial. Okay, beta? Because we have to take endometrial biopsy. Here it will be a thin, and we will be able to find the endometrial, the tuberculosis organism. Hope beta you love this, and I tried to go very superficial and very fast so that I can complete this on time. Thank you.